now, and we are starting webinar now.
Okay, welcome everybody. I'm delighted to welcome you here today on behalf of the Pandemic Action Network and all of our co-conveners, including the COVID Gap Initiative, to this global call to action to end the COVID-19 crisis and prevent the next pandemic. A huge thank you to being here today. There's already nearly 200 of you online, and that's growing all the time. So let's start with why we've called this convening today. Because despite what many governments want to think, COVID-19 is still spreading and mutating, and we need to keep working to save the most lives we possibly can. Because we cannot afford to be unprepared for the next wave, variant, or novel pathogen. And because if we do stay the course on this response, we will be better honing our systems for future preparedness. And because despite the continuing need for response and preparedness, we're at an inflection point. Many societies are opening up. Governments are focused on the invasion in Ukraine. It's getting harder to advocate. So what does that mean for our strategy? These are a few of the questions we'll be considering today. Since the invasion of Ukraine in late February, the political energy globally has shifted. Of course, we respect the need to respond to this and other crises in the world, but we're here with our own mini summit here today to remind leaders that we will not stop advocating until the job is done on the COVID-19 response and future preparedness. In our call to action, which CSOs signed on to, which you can see posted in the chat, signed on to by over 30 organizations, we're calling for progress in three main areas: to accelerate equitable access to and acceptance of vaccines, diagnostics, and therapeutics, to provide new diversified funding to fill country-identified gaps in both response and preparedness, and to build now to pandemic-proof the future. We simply can't afford to wait. Our ultimate goal has to be to save the maximum number of lives. In our call to action, we commit to pushing to reach global and country targets for COVID tools, including vaccines. We need to have a smarter strategy that better prioritizes, but we also need to not let go of equity. We need to have equitable protection. And when rich countries have pushed to vaccinate as many of their population as possible, that needs to be the goal for everybody everywhere. This can be a both and approach. More strategic, more prioritized, serving the vulnerable first, but also making sure that we don't lose that ambition, that scale to get that equity of vaccination and access to all COVID tools in all countries, including LMICs. That's why rich countries who have vaccinated most of their population, we can't have a clarion call from them having a different outcome for poorer countries. So these are the kind of issues that will be subjects of our discussion today in the sessions. So how will today be structured? First of all, we'll be looking at the landscape of COVID. What's happening right now? How has the response changed? What are the different issues at play in different countries? Session 2, we'll look more at what needs to change because of these different shifts in the landscape. And then session 3, how to change it. How can we all as advocates, organizations, whichever walk of life you come from, how can we work together to take the action we need to deliver on both the response and pandemic preparedness? But before we start, we want to get a sense of what you think. So there's a poll going to appear on the screen, which we'd love you to take part in. And the question is simply, in your view, what is the most urgent priority for the global COVID-19 response and future preparedness? There are 5 options there. Pick your favorite, and we'll give you about 30 seconds to respond. Is it equitable access, demand and delivery, funding gaps closed, prioritization of COVID, or health workforce and health systems? very difficult to choose between them, but we'd love to get a sense of where your priorities are so we understand a bit where you're coming from as we go through the sessions. They're all interconnected, as people are pointing out in the chat, and I would encourage you to both engage in the chat and the Q&A throughout these sessions today. Are we closing the poll? I think we will when we have enough people participating. What are the results? Equitable access is the winner by quite some margin. Health workforce and closing funding gaps in a almost neck and neck. Funding might just have it. Oh no, I was looking at the lines. We have the numbers there. Fantastic. So they're neck and neck. Brilliant. Thank you all for involving yourselves in that. We will include that in the notes. So it gives me great pleasure to hand over to our MC for the day, Gary Edson, the president of the COVID Collaborative. Gary, over to you to take us through the rest of today's proceedings. Thank you.
Thanks so much, Eloise, and welcome on behalf of the COVID Global Accountability Platform. COVID Gap is a joint venture of COVID Collaborative and Duke University, designed to serve as a source of evidence-based recommendations and a platform for the kind of collaboration we have here today. As Eloise noted, and as the poll reflected, we're at a pivotal moment in the pandemic. Omicron has changed the trajectory and epidemiology of the pandemic. If we don't update our strategy and priorities in response, we'll be left fighting the last battle, not the next. We hope to hear today many diverse perspectives on what an updated strategy should look like, with a view toward aligning around a few key priorities. To spark that discussion, I'll share COVID Gap's perspective, as outlined in a just released report now in the chat that was informed by many experts in Africa, Asia, and Latin America. This report calls for a shift from emergency crisis response to a strategy of sustainable pandemic control that strengthens health systems and future preparedness, recognizing that COVID may be with us for years to come. We believe this strategy must be country-led and respond to key post-Omicron realities. As we'll discuss in our first session on the state of the pandemic, Omicron's high transmissibility and partial immune evasion have changed both the purpose and definition of vaccination. The purpose of vaccination with current vaccines is now to prevent severe disease, hospitalization, and death, not primarily to prevent infection or transmission. Plus, there's growing recognition that full vaccination with most vaccines means a third dose plus boosters. So the best way to minimize severe disease, hospitalizations, and deaths and protect fragile health systems is to prioritize fully vaccinating, including boosters, those at highest risk. The good news is that vaccine supply has dramatically increased, and new oral antiviral therapies are available, though urgent action is needed to ensure equitable access. Unfortunately, pandemic fatigue in high-income countries eager to put COVID in the rearview mirror is threatening to erode support for the global response. At the same time, as Eloise noted, the horrific military and humanitarian crisis in Ukraine is consuming growing attention and resources. In light of these post-Omicron realities, the question is, what needs to change? This will be the focus of our second session. How do we save the most lives, most equitably, in a world of competing priorities and finite resources? We believe the answer is to prioritize 4 key actions. First, support country-driven, bottom-up goals to reflect local realities and priorities. Second, prioritize as the immediate vaccination goal, fully vaccinating, including boosters, high-risk groups, and health and other essential workers, aiming for 90% coverage of those at highest risk to save the most lives most quickly. Countries should set their own population coverage targets, which should be robustly supported by the global community while prioritizing fully vaccinating at-risk populations. Third, provide equitable access to oral antivirals through test and treat capabilities as part of a vaccination plus strategy. And fourth, increase local manufacturing capacity, especially in Africa, for vaccines, therapies, tests, and other critical tools. All of these actions will require increased financing, more inclusive governance, and more rigorous accountability for results. Issues we'll discuss in our final session. Now, I realize that others may have different priorities, which is why we've teed up a robust discussion. But I also know that we're all here today because we agree on one thing: urgent action is needed. The greater the delay in adapting to new realities, the higher the cost in lives, health, and economic prosperity. To help us plot a post-Omicron path forward, let me turn to Dr. Ahmed Aguel, Deputy Director of the Africa Centers for Disease Control. Dr. Aguel.
Thank you very much, Gary, and good morning, good afternoon, good evening, wherever it is that we are joining from. It's really a pleasure and an honor to speak at the global call to action as we aim at ending the COVID-19 crisis, indeed work towards preventing the next pandemic. When we look at the life of any outbreak, any pandemic for that matter, we see that in the beginning, we largely use our public health measures to try and bring it under control. We've done a lot of this in COVID, and Gary, I fully agree with you that for some of us, it's become tiring to continue to wear masks and social distance and stay away from friends and family. But these have to be done. That's the only way to try and buy time so that we can be able to deploy other better tools for purposes of controlling the pandemic. For COVID-19, we shifted relatively fast into the vaccines and vaccination phase. And this didn't come without big lessons. And for us in Africa, it came with a big lesson that equitable access to vaccines, indeed to diagnostics and therapeutics, is not that easy for those who may not have available resources to purchase these very, very important commodities. Now, when we look at how we have performed over the last 2 years of the pandemic, there is hope that as human beings, when we know the right thing, we can be able to do it so long as we are motivated to do it. And for many of us during this pandemic, the motivation was the fear of illness and even death. Our motivation should, however, be maintaining public health, because when we work towards maintaining public health, then all of us benefit, rather than the fear of only the self, where we want to protect one person, ourselves, instead of many people, the public. So if the motivation is right, we can be able to protect a lot more people. But using these lessons, we need to look into the future and start preparing now, so that we not only act for COVID-19, but we act in advance for any other pandemic that may be able to visit our shores. And I have 3 proposals for you to reflect on what we need to do. The first is we need to start thinking of this world as one, not us and them. The moment we begin to appreciate the oneness of the world, then our actions will reflect that oneness, and it will be everybody counts, rather than we do it for ourselves first, and then later on we can be able to help our neighbors, indeed other communities as well. We must think of this world as one. The second reflection I would like you to have is that going into the next phase of the pandemic requires that vaccination actually happens. Not that vaccines become available, but vaccination actually happens. And this is our reality here on the continent of Africa. If we don't get vaccination levels up, then we risk new variants, which we don't know which direction they will go. They could be more dangerous than the ones that we currently have. We need to get vaccination properly rising in Africa and other parts where the vaccination rates are still low. And we need to engage with members of the public so they appreciate and understand why we need to vaccinate at higher levels. The third reflection that I would like you to think about as we discuss today is the fact that we must accommodate the clear fact that globalization at multilateralism at the global level did not work as expected, not during this pandemic. Regionalism, on the other hand, actually worked very well, particularly for us here in Africa. So we need to revisit how we look at health security at the global level. We need to revisit how we look at health security at the regional level and pick all those points that are good and use those to prepare for the next epidemic, for the next pandemic. We cannot have the same structures in place that did not deliver for COVID-19 pandemic. For the future pandemics, we need to design and agree on new ways of doing things when it comes to health security at the global, at the regional, indeed at the national level. These are the three things, Gary, that I wanted to reflect on as we go into these discussions for today. And it's an honor, pleasure to be able to share with you our thoughts from the Africa CDC. I thank you.
Doctor, thank you so much for that fabulous presentation, noting that we need to ensure that we operate as one world, such a profound point. Second, getting shots in arms. And third, revisiting the health security infrastructure at all levels, global, regional, and local. Powerful points that brilliantly set the table for our first session, focusing on the state of the pandemic, where we are and what the response is, regional and country level perspectives. Now, let me introduce our moderator for that session, Dr. Desta Laku, Group Partnerships and External Affairs Director, AmRealth Health Africa. Dr. Desta will introduce the panelists for us. Desta, over to you.
Thank you so much, Gary, and you have given me the privilege of calling me doctor, which I am not, but I will accept that.
I gave you a battlefield promotion.
Absolutely, absolutely, and it's such a pleasure to be here, and we have a fantastic panel ahead of us. And just really briefly to introduce them, Sidi Aguel, who is the Regional Director of Asia Pacific Vital Strategies, Dr. Maria del Carmen Khalid Davila, who is the Executive Secretary of the Andean Health Agency, Anne Lindstrand, Dr. Anne Lindstrand, who is the Unit Head for Essential Program of Immunization at WHO. Yes, Rosemary Mburu, who's the Executive Director of WAKI Health in Kenya. Of course, Raj Panjabi, who's a Senior Director for Global Health Security and Biodefense at the National Security Council of the US. And Dr. Siti Nadia Tarmizi, thank you for joining us, Secretary of the Director General of Public Health Indonesia. So as you can see, we have a fantastic panel which has joined us. This session really aims, as Gary said, to set the scene on the evolving state of the COVID-19 pandemic, as well as to assess the current state of the global response and preparedness, both what's working and where we are now, and if there are any new or enduring gaps that need to be addressed. And of course, we recognize the highly dynamic and regional nature of the pandemic. So in this session, we hope to discuss some of the main lessons learned so far from the pandemic and how it's shaping strategic decision-making. And then finally, to understand how the pandemic will lay the groundwork for strengthening pandemic preparedness and ensuring health system capacity building to withstand health security challenges. I echo what Dr. Ahmed said earlier. For the region particularly, we have great challenges that we're working on together. So without further ado, we have a fantastic panel, and I'm going to go around and ask. This is a discussion, a conversation, really, and I'll start really with Anne. Anne, as the head of EPI at WHO, you are uniquely positioned to see how the global response on COVID has evolved over the past year. Could you perhaps just briefly share with us where there has been progress in the COVID-19 response, especially with vaccinations, and where there are still some acute gaps? Anne?
Thank you so much, and be an honor to be here today and discussing with you all afternoon. First of all, the global increase in COVID-19 deaths continues now. The pandemic is not over. It's driven by large outbreaks in Asia and a fresh wave again in Europe. Several countries are now seeing their highest death rates since the beginning of the pandemic. This really reflects the speed with which Omicron spreads and the heightened risk of death for those that are not vaccinated, especially the older populations. Until we reach high vaccine coverage, as Dr. Ahmed was saying, in all countries, we will continue to face risk of infections surging and new variants emerging. A third of the world population remains still unvaccinated. The insufficient supply and unequal distribution of COVID-19 vaccines that we saw in 2021 since the beginning of 22 has shifted into a surplus more on supply. The focus is really for all of us on global vaccine rollout. And now it's solely on delivery in country, including increased absorption capacity and raising demand for vaccination as well. With the newly formed COVID-19 vaccine delivery partnership, we, WHO, UNICEF, Gavi, Africa CDC, and many implementing partners, including the World Bank and many other partners, are working with those 34 countries lagging mostly behind, furthest behind, those that were less than 10% in mid-January, to address country by country bottlenecks to increase coverage through certain levers: political engagement, vaccine delivery funding, demand planning, and specialized technical and search support. However, beyond that, there's been a spectacular catalytic effect of the pandemic on the African continent, triggering a launch of so many good initiatives meant to address the equity gap, such as AVAT, and not the least also the newly focus on actually securing local production of vaccines, looking much beyond this current pandemic. The pandemic has really reminded us the necessity to look beyond vaccines and invest in those pandemic preparedness systems, health systems, strengthening systems that needs to be done right now in preparation for the next pandemic. We see that the countries lagging most behind are also those that are struggling since decades with the weakest health systems. Really, vaccine delivery is an important opportunity to making long-lasting investments in the healthcare systems, including routine immunization and primary healthcare. Finally, another important evolution that we've seen in the past month relates to the impact of Omicron on the risk perception. There's a shift in the risk perception in many countries and societies as Omicron is perceived as less lethal, and even if it's highly transmissible. We really want to get out of this pandemic, all of us, and get back to normality, but this pandemic is not over. The UN target of vaccinating 70% of populations in every country by mid-year still holds. However, there is an important shift in the focus and the work that we're all dedicating towards, shifting focus to priority in reaching the highest risk groups, so given to healthcare workers, the elderly populations, and those medical risk groups that are still unvaccinated. And achieving this target is essential to save life, prevent the risk of long COVID, protect health systems, and increase population immunity. Thanks.
Thank you so much, Anne. Absolutely, we see where the investments need to be, and certainly looking at the highest risk groups are critical. So let me just move to Dr. Nadia. Dr. Nadia, we had the privilege of speaking to Professor Kadir, the Director General of Health Services in Indonesia, earlier on the evolving landscape of the pandemic in Indonesia. And I first want to congratulate you on the leadership of Indonesia for the exceptional work you've done in vaccination. I understand it's the 4th highest in Asia, so I want to acknowledge that and also acknowledge hospitalization rates have been going down. Perhaps you can say a few words on that and also on the shift of the pandemic now being viewed as an endemic. And then I'd like to shift to ask you about the leadership of the Indonesia presidency in G20. And as part of the G20 focus on global health architecture, equitable access to COVID vaccine was prioritized, and in particular, it highlighted stronger global cooperation. So recognizing that there has been much work going on in this area, would you briefly share with us what progress has been made? Dr. Nadia?
Thank you, Desta. So 3 main strategies to fight against COVID in Indonesia. The first one, as we are aware, the prevention strategy that we implement, the health protocol, what we call it 3 M's. It is Indonesia abbreviation, of course, which include wearing masks, social distancing, and promoting hand washing. And even at certain conditions during when we are facing the Delta wave, we add more 2 M's, which include mobility restriction and avoiding the crowd. The second strategy is earlier detection through massive testing and tracing, including early treatment. And the third strategy, as we know, that's vaccination. These strategies, of course, are implemented parallelly. During the Omicron, as mentioned by the previous speaker, that it has been changed this pandemic situation. And then our strategy is evolving. We still, again, implement the 3 main strategy, but slightly changed since we are aware that the Omicron transmission can be 2 to 6 times more compared to Delta transmission, which means more people will get infected, but might be less hospitalization and death. Learning from other countries, we have high coverage vaccination. It will have less severe cases. And we have started, of course, this evolving of the strategy, for example, in Omicron, in order to maintain the number that we need the hospitalization and death cases, we have to make a strategy how to reduce the hospital burden. We are, of course, focusing on the treatment strategy, which allow us to detect at earlier stage. So people without symptoms or people with mild symptoms and without comorbid can do self-isolation at their home under supervision from the health care worker, or they can be isolated at the government facilities. Currently, in terms of the vaccination, Indonesia has been provide like 370 million doses, which 195 million already got the first shot, and 158 million or for the second shot. And we start for the third booster currently as part of our roadmap to come out with a new strategy in order to end pandemic. And with this, like 57% out of 270 million people already complete their vaccination. The other strategy, of course, beside those I already mentioned, we implement what we call it the PPKM, or the public health and social measure that regulate people activities. With this public health and social measure, we are able to give the feedback at the province, districts, and the cities level for their response, including how to adjust social activities. In terms of Indonesia is G20 presidency, we aware that we are restrained from traveling. Cross-border was restriction. Cities and state and country are forced to be into lockdown for almost 2 years. And of course, other sectors such as trade, tourism, transportation, education were heavily affected with the following collapse of the more cross-border mobilities. So with that, to allow gradual cross-border opening, countries start to implement the public health risk reduction and measure on cross-border travel. However, as both authorities and travel have to implement different health protocols that constantly change and are disconnected from other to another. So it's a net increased costs and sometimes adds complexities and cause inconvenience. This can be changed. In responsible way, we are able to ease people's mobility from city to another, from country to another. And Indonesia assumed that the G20 presidency under the theme of Recover Together and Recover Stronger, Indonesia take this baton from Italy, is committed to promoting global health architecture strengthening toward a future pandemic. And of course, at the same time, it's allowing safe international travel. Given the restriction, the lockdown, and the global economic downturn, the pandemic has taught us how to interconnected and interdependent we are. We therefore need to work together to mutually recognize the digital information such as testing requirement and result, vaccination certificates, and mutual recognition of digital application. It is essential for G20 members to come together and how to would be better prepared for current and future health crises through the establishment of the financing mechanism that could be well responsive to the rapid demands for resources during the health emergency, and including expanding the global manufacture and research hub for next pandemic, of course, including for vaccine equity. G20 members have voiced their support to this. G20 members have voiced their support to this initiative, and we hope that the accomplishment of this task could be a game changer in our collective efforts to tackle the pandemic and the health emergency at present and the future as part of the strengthening global health architecture.
Thank you so much. Thank you so much, Dr. Nadia. We'll come back to you on the G20 with questions. Siti Ariel, Siti, are you with me? Many of us are really familiar with the measures that Singapore has taken with respect to COVID, including community-driven contact tracing, the massive vaccination efforts, and more recently, safe travel lanes, and other key initiatives. And while we saw the jump in cases this month, it seems that that is now coming down. Siti, maybe you can share with us, what has the COVID-19 response looked like across the rest of Asia, and how has it evolved? Are there countries that have had successful and dynamic strategies?
Thank you so much, Desta, for the opportunity. It's good to meet the fellow panel members. Asia is a fairly large continent with variability in terms of different countries that have different governance modalities, different accountabilities, different population dynamics, age, population concentration and whatnot. In the first, when the first round of COVID hit, we had examples from countries like Japan where people were able to stave off from the first wave just by virtue of their self-governed social distance as well as hygiene. It was really highlighted in media as well. Certain countries in Asia like China and South Korea were able to manage case identification and also do effective contact tracing as well as mobilize their resources, which ended up with them staying ahead of the curve. There are some countries like India, Nepal, some South Asian countries where governments had to initiate social distancing rules and also to kind of control measures. So I think from those periods, moving on to how the COVID response evolved, countries developed a sense of wanting to really stay ahead by vaccinating more of their populations as Delta and Omicron variants emerged. And I think there was a scrambling for vaccines for many LMICs in across Asia. Those countries that were able to do planning ahead of the time were able to get their orders in and so vaccinate their people. But others, like, for example, Pakistan, Bangladesh, Myanmar, Nepal, with poorer logistics, were also struggling in terms of getting their populations vaccinated. Again, countries like Japan, Singapore, as you've mentioned, and others stayed ahead of the curve, who were able to get their orders in and have better logistics. I think in terms of the case, as was mentioned by other panelists as well, situation is quite fluid. We have examples from countries and regions where the segment of population like elderly, for example, in Hong Kong, not being vaccinated to the extent that elderly population in New Zealand got vaccinated, ended up with increased case fatality. So it's still very much a moving piece. I think countries in Asia Pacific, in my review, or in terms of what we have looked at, that were able to do well despite resource implications, were, for example, Cambodia, that was able to do quite well. I think their vaccination rate is ahead of Japan and Australia. They were able to mobilize the use of digital infrastructure to get people registered for vaccinations as well as for contact tracing. I think Singapore government also is quite pragmatic in terms of being able to really let the pressure off when the situation on the ground improves, as well as mobilize strategies when the situation is offhand. So I think for me, the underlying message is that vaccines are a very important tool, but so is ongoing surveillance, public health measures, protection of the vulnerable populations, and especially prioritizing healthcare populations across Asia Pacific. I think we also need to reflect on health systems, as I think Dr. Ahmed put it very succinctly, a global village as one. I think resilient societies cannot exist without robust health systems. Therefore, investing in health systems is the only way to prevent the next pandemics. And I think COVID-19 has shown us that when there is will, especially political will, we're able to get things done that we wouldn't have been able to do otherwise. But this has also shown a lot of human elements in terms of how countries behave with one another, with their regions, with geopolitical considerations and stuff like that. We saw vaccine diplomacy, we saw other issues as well. So we should learn lessons from COVID pandemic last 2 years and be able to really strengthen our health systems going forward. Thank you very much.
Thank you so much, Sidi. I appreciate that. I'm going to come to you, Rosemary, now. Welcome, Rosemary. I know you've been a huge advocate on behalf of civil society here in Kenya and in the region. So many have heard about the challenges with vaccine delivery on the African continent. It was mentioned earlier as well, and that distribution and delivery to the last mile and demand generation have really overtaken supply issues. So how would you characterize this challenge for vaccines as well as testing and treatment? And what's your perspective on successes and challenges? And I ask the speakers to please stay to your 3 minutes if possible. Thank you.
Yeah,
Rosemary.
I'll be quick. Yes, Desta, if you can hear me, I'll be very quick with that. And thank you so much for your question. I think just in terms of taking a quick scenario, in January of this year, the government of Kenya received vaccine doses that had an expiry date of 28th of February. That means in less than 2 months, the government of Kenya was expected to actually deliver those vaccines to populations in Kenya. And I think there lies one of the biggest challenges with vaccinations across Africa. The fact that the donations are happening and we are seeing more vaccines coming into the continent. But the biggest challenge is now converting those vaccines into vaccinations, because one of the biggest challenges is around the short shelf life that the vaccines are coming with, especially those that are donated. The African CDC has been vocal in saying that these donations to Africa need to not have less than 3 months of shelf life. And we still are not seeing that. We are still struggling with that. So I think one of the biggest things that needs to happen is to think about, even with the donations, how do we transform these vaccines into vaccinations? The second thing, if I may use Kenya also an example, is that this March, again, the government of Kenya has waived the requirement of wearing masks in public spaces. And what that is likely to do, and is already doing, links very well with the first panelist, Dr. Lindstrand, who said about the perception of the pandemic and the infection is really going down. And we really need to think about how do we anticipate any implications on that. The fact that you have people having not be required to wear masks, which is okay, but I think we need to be able to anticipate the consequences and the implications of that. And one of the things that needs to happen is to step up the information appreciation of science, appreciation of the epidemic and the pandemic, and really continue with the conversation, informing communities, informing the public around the dangers of not continuing with the precautions. And the third thing is, I think we are learning from COVID-19 is really about how we respond from a comprehensive point of view. One of the challenges and things we struggled with early on with the vaccine injustice, where very little vaccines were getting to low and middle income countries, is that no vaccines were coming, no tests were happening, so no vaccines, no diagnostic, no treatment. But even when vaccines started coming, there was a big focus on vaccines, which is great, and we know vaccines are very important. But in a scenario where in Africa, for example, the continent has only vaccinated about 10% of the population in the region, you ought to make sure that the response is comprehensive, make sure the vaccines are in there, make sure the diagnostics are there, make sure the treatments are in there, make sure it's a very comprehensive response, and really think about how you integrate that with health systems. Think about even of rapid diagnostics as opposed to diagnostics that do not really work for the region and for the scenario that we are dealing with. And I think one of the things we have learned throughout the pandemic, even as things are shifting, requirements of wearing masks, populations are coming up to be vaccinated, we have challenges, but it is going to be very important for any global health response, this particular pandemic and future pandemics, to think about how to better engage communities and civil society, especially with communities. In Africa, the biggest response was supported by community healthcare workers, communities moving from door to door. And I think it's important to incorporate that thought and element even as we are designing. And the last thing, Desta, is to really support the statement from the panelists who just spoke about before me about health systems. If we are going to end this pandemic and also be better prepared for the next one, we will need to think about how everything integrates within our health systems and how we invest in health systems that are built not just for routine immunization, not just for routine services, but also for responding in pandemic situations. I thank you.
Thank you so much, Rosemary. Very well put. I'm going to ask Dr. Marie-Carmen to join me. Marie-Carmen, in your role as the Peruvian Congress President, you've had an opportunity to examine the impact of COVID-19, not just in Peru, but across Latin American region. And we have seen that the burden of COVID-19 has been high in many parts of Latin America. What should we learn from the experience so far? And looking ahead, what would be the biggest priorities for the COVID response across the Latin American region?
Oh, good morning from the Andean region, good afternoon and good evening for other latitudes. It's a pleasure to be part of this panel, thanks to my colleagues. The burden of COVID-19 has been high in Latin America and in the Andean countries, from north to south. I'm talking about Venezuela, Colombia, Ecuador, Peru, Bolivia, and Chile that are part of the Andean organization. South America has only the 5.5% of the global population, but it has the 21% of death due to COVID-19 in the world. It also has the highest lethality, which is 2.3, and the highest number of deaths per million people, 2,916 versus 775 per million as global average. In the Andean countries, there is around 166 million people, and we have lost 2,608 people for every million inhabitants. That doesn't seem fair. And why does it happen? The social and health scenario in the Andean region is characterized by great social inequalities, about universal social protection. We can say that many people do not even have access to water, about right to health approach. People who don't have medical insurance have very poor health care or none of at all. Health services are insufficient. The average number of hospital beds is 1.5, far below the desired standards of more than 4 hospital beds per 1,000 inhabitants. There is also a large deficit of human resources in health. What pandemic has shown? The pandemic has highlighted inequalities between countries and within countries, the fragility of health systems, the close relation between health and economy, the need to build regional response capacity to avoid dependency. 2 years later, after the pandemic began, the scenario is pandemic does not end. And even if global numbers decline, it has not ended. The Omicron variant BA2 is quickly becoming the dominant strain in many countries. Countries with high external debts, which has led them to fiscal austerity policies and reduction of social benefits, uncertainties about the virus and its natural behavior, higher unemployment and poverty, setback in social and health policies, orphaned suffering, health work burnout, further enrichment of the medical industrial complex monopolies. But on the other side, fortunately, we have also seen great advances in the development of vaccines and research, genomic surveillance and telemedicine, extensive scientific productions, demonstration of solidarity between some countries. Much and very hard work has been done in all countries to respond to the crisis. We have taken lessons from the pandemic and learned how paralyzing a pandemic can be. However, I call on us to focus on the causes of the crisis. We must go beyond the pandemic and discuss how humanity understands development. What does it mean to take care of life? How humanity coexists with nature. What we have learned is that pandemic emerges on the basis of inequality and the poor relationship between humanity and nature. We have learned that we were wrong and that we cannot go back to that point. What are the specific health priorities that have not changed? Vaccines, research, surveillance, sovereignty, strengthening of health systems, be care of the communication. But in my region, we have to talk about price negotiation, corporate buying, and the priorities beyond are confront the structural basis of inequalities, another model of development and consumption, and guarantee social and environmental justice. Yeah. And I want to remind you that in this globalized world, we will only be safe when we are all safe. Together, absolutely, we are stronger. Together, we go farther.
Thank you so much, Maria Carmen. Really appreciate that. We are running low on time, but I'm happy to introduce my next speaker, Raj Punjabi. Raj, are you here? Is Raj here? Yes, I am here. Hi. Raj, it's such a pleasure to see you after so long. Congratulations are in order for the new role that you're playing with the USG. And we're thrilled that you have you here. Raj, we were really thrilled to participate in the Global COVID Leaders Summit last year, and I'm not really sure what actions came out of that summit. And as you look, so I want to just ask you about this. As you look to hosting the next Global Summit, has there been a shift in the US strategy to support and accelerate the global COVID response at this stage of the pandemic? Because we're a bit further ahead than we were during the last summit. And given that this is a fast-moving target and the landscape may have changed dramatically since the end of last year, can you speak a little bit to that? And perhaps you can also comment on the waning attention and commitment to the global response that we've been seeing.
Well, thanks, Desta. You know, as a doctor, I don't like giving bad diagnoses, but I'm a little worried that the world is suffering from a case of PIO, or pandemic is over syndrome. And we've seen this before. After the West African Ebola epidemic, we saw EIO, Ebola is over syndrome. But we have to remember, COVID-19 has caused millions of deaths. Death rates may have dropped significantly in some parts of the world, but we're still seeing tens of thousands of deaths. That's an aunt like my own several weeks ago who was immunocompromised. those of many of you and your extended families and communities, we're seeing that tens of thousands of deaths globally from COVID every single week. So Omicron has changed the battlefield. And you asked about the US strategy. We are evolving our strategy with the enemy. We know now it is difficult to eradicate or eliminate COVID-19, but we can still get it to a place where it's a manageable respiratory illness. We can sustainably control it. So how do we prevent PIO syndrome? There are four really key features of the challenges that we think we need to take on. Number one is to accelerate vaccine coverage and uptake, especially for high-risk populations and regions. We think there's an opportunity for countries to really think about expanding their national vaccination plans so that they don't only aim at achieving 70% of their general population being vaccinated, but also fully vaccinate their at-risk populations, those at highest risk of severe disease, hospitalization, and death, like the elderly, like the immunocompromised, like frontline and community health workers. Under President Biden's leadership, we've committed to donate 1.2 billion vaccine doses to the world, with more than 500 million doses already delivered in 113 countries. We're proud of this, but the challenge now is turning these vaccines into vaccinations. We need to bring vaccines to people, not wait for people to come to vaccines. We've got to expand the vaccinators and the vaccination sites. Vaccinators should be expanded to beyond nurses, to community-based health workers, where that is in line with countries' policies, as we're seeing some countries do. The second thing challenge we have to take on is to advance national test and to treat strategies. We're doing that already in the high-income countries, and we're making strides, but we've got to do that in some of the poorest countries on earth to ensure that we implement a test and treat strategy, both at the community and primary care level. In both of these areas, Desta, the Biden-Harris administration, as many here know, has made a major request to Congress as part of our $22 billion supplemental request. $5 billion roughly would be to support our global response in these areas. But to date, Congress has stalled, and the virus is not stalling at all. Congressional inaction hampers our global response. We know this virus knows no borders, and leaving large unvaccinated populations worldwide isn't just the wrong thing to do because it will lead to more losses of life, but it will increase the risk of new deadly variants emerging that could put all of us at risk in all parts of the world. The other two things, Desta, we need to do, and then I'll briefly talk about the summit, is strengthening the capacity of health systems to prepare for and respond to shocks and minimize health service disruption. I've been on the front lines in COVID clinics before being vaccinated, being forced to reuse the same gown all day, coming home worried about risking infecting my family, seeing my kids be amused because I take off all my clothes, but nonetheless, me being worried about infecting. And that anxiety of being unprotected while caring for patients with this virus is unlike any other I have ever felt. And it's a fear that many health workers still feel who are under-vaccinated. So we've got to protect the front lines, PPE, high quality PPE, which is still unavailable at some of the community health worker levels and in community clinics. But we've also got to make sure all of the health workers are vaccinated and fully. And the fourth issue that I think we need to take on is financing and filling gaps in disease surveillance, research and development, countermeasure manufacturing in low and middle income countries, and other efforts to stave off the next pandemic. We've got to act on that now. And yesterday, the president released a robust FY23 budget request in which we are requesting tens of billions of dollars in additional funding for domestic and global health security and pandemic preparedness. As Ahmed said from Africa CDC, this is a signal that we see the world as one. There is no us and them. Investing in health security here and abroad means investing in health security for everyone. We hope this demonstrates to the world the seriousness of the U.S.'s intent to expand the fight against COVID with but also to prepare and prevent the next pandemic. Now, to your second part of your question.
Let me just interrupt you 1 second and ask you, does this mean that the U.S. strategy has shifted, or are we still on the same strategy from the first summit? And with the issue of Congress, yes, that's always the case in USG. I understand that. So what is happening? What is happening that is different? I guess that's the question I want to ask you. What are we doing differently now, or how have we shifted the strategy in a different way?
Yeah, great question. So with first of all, with the summit, we're planning to retain the themes of the first summit, including vaccinating the world, second, saving lives now, and third, building back better health security. And that's because the challenges I just mentioned are quite the same domains, but different in degree or in nature. So we're still seeing those as critically important areas, Desta, of our work through which we should make commitments. Now, here's what's different. Number one, let me clarify. We want to make sure that there is global attention and action. So number one, we will have co-hosts. I hope to share the specific countries soon, but I can share for now that our summit country co-hosts are in regional and global leadership roles in 2022, and they will help us drive the message that this is a global problem requiring global leadership. The second difference, Desta, is we will use a step up to speak model. We'll be asking partners to make concrete new commitments to secure speaking roles in the summit. We want to garner tangible commitments from others along the United States, like the ones I just mentioned. We think these are going to be essential to reaching our summit goals. What specifically will we ask for? For high-income countries, we are making significant financial asks, including funding for vaccine readiness, activities and support, expanding test to treat strategies and availabilities, contributions to the new Global Health Security Financial Intermediary Fund, the fifth at the World Bank. This fund has gained momentum and continues to gain momentum and will support preparedness for COVID variants as well as future threats. We're also, Desta, asking for low and lower middle income countries to shift domestic policy commitments across a range of areas that we think can accelerate the end of the acute phase of the pandemic in their countries. For example, that includes creating those national vaccination plans that prioritizes vaccinating fully at-risk populations, ensuring that there's implementing of a test and treat strategy at the community and primary care level, expanding support for frontline and community health workers, and ensuring that they use this crisis as an opportunity to invest in long-term capacity for preventing the next pandemic. So that's really what's different, Desta. We're hopeful after the summit we'll have achieved a range of substantial financial and policy commitments that can help us achieve our collective goals to end the acute phase of COVID-19, stop new variants, and ensure that we're able to recover universally and globally from this pandemic.
Thank you so much, Raj. And we're coming back to you at some point soon. So hopefully the objectives of the USG will be met, and you'll get global support to have other actors also step up to speak and make tangible investments as well. And we hope that the Congress will push through your commitment of $5 billion for to support the global response. So looking forward to hearing new things, and certainly looking forward to see the agenda. There are so thank you so much, Raj. I'll call back on you in just a minute. We have actually passed the time, but just very quickly, there are questions in the Q&A if you can answer them directly. If not, for those of you who have asked questions, we will make sure we get those answers out to you also with the follow-up. So thank you so much. I think in wrapping up basically what we have heard from all of our speakers, and all of them were quite prolific, we realize it is a fluid situation and we are not out of the woods. There are vulnerable populations that we need to prioritize, more vaccines also for community health workers and those who are at the front lines, considering, of course, then prioritizing also equity is needed, more vaccine and arms are needed. Looking at certainly examining the fragility of health systems and the need to invest and build the capacity of health systems, leveraging, of course, digital infrastructure. Political will is critical. We see that. especially in what Raj has said as well. And engagement of civil society and community is critical as well. So this is what we've heard so far. I would want to just turn, I think we have maybe a minute or two from our speakers. If there are any one of you who might step up and answer the question, how do we now maintain focus and prioritization on the global COVID response? So if I can open it up to any one of our speakers, whether it's Raj, Rosemary, Sidi, Marie Carmen, or Dr. Nadia, how do we maintain focus and prioritization on the global COVID-19 response, especially when we see it's compounding with the geopolitical crisis and COVID fatigue? Any one of you can just step up if one of you can answer that question.
Yeah. Okay, Desta. So first, I think we need again, to do the less restriction. Of course, we again in terms of allowing more activities at the community level, we still need aware on the trend of the COVID-19. So it's mean that we need to have a good surveillance. With a good surveillance and the high coverage of vaccination, I think we can maintain a low transmission. And with that, in certain time, we might again to reduce very small number of cases, so which means that we can ending the pandemic. So I think that's two keys. And of course, the health protocol, it might be considered gradually have a relaxation.
Thank you. Sidi, is there anything you'd like to add to this? I see Rosemary, your hand is up as well. Let me just go to Sidi and then come to you, Rosemary.
No, I think the message has been emphasized by fellow panelists a number of times that I think strengthening surveillance, like, ensuring that health systems priorities are not neglected, and supporting countries in the course of their regular vaccinations as well, helping them prioritize and really building capacity of countries' LMICs, I think is the way to go, prioritizing health work. Just like to emphasize that. Thank you.
Thank you, Rosemary. And then Maria?
Yeah, so just to emphasize, to remind us that because of the vaccine injustice that has happened since the beginning of the pandemic, there's a lot of catch up to be done, especially by low and middle income countries. And therefore, we are not there yet. And we really need to think about equitable access and demonstrate that with investments and other political will that is needed to actually get there.
Thank you. Maria Carmen? And then we'll wrap up with you, Anne.
And health must be considered the center of development. It's the first time in many years that health is in the center of the policies and the politics. We cannot, we have to make advocacy for that. We need to talk about other dimensions for COVID response. We're talking not just of the health sector, we're talking of the economic, the social, the fiscal sector. We have to have alliances with them. And please don't forget the long-term economic, social, and environmental objectives, as well as our international obligations. No, if we go together, we will go further. Thank you.
Thank you so much. Anne, can you wrap it up for us?
Yes, I am so humbled by all the good thoughts of this panelist. Honestly, Dr. Ahmed, the one world that, as well as Maria, the social justice that we need to create here is just so pivotal. How we need to strengthen systems has been concluded. Rosemary is saying we need to show the value of the vaccine to create that demand. And then finally, honestly, we all said so, but high risk groups, so that Raj or any other frontline healthcare worker could feel safe when they're at work. They are protected, they're getting the vaccination, getting us not just to 70% by population, but to reach 90 or 100% of all healthcare workers, older populations or vulnerable groups. I just wanted to say one more last thing, and that's we need to think beyond now on integrating the COVID-19 response into regular routine immunization programs. There's been a massive surge here. So in the immediate, use the attention and resources right now to strengthen cold chain, etc. But then in the future, also integrate them into the regular healthcare system, whatever that immunization program will look like. We don't know yet, but we hope that we can land this massive effort into strengthening routine immunization and primary healthcare in the end.
Thank you so much for that. And Raj, I realize you're the only one I didn't ask. And as we wrap up, if you have any comment last minute, but three takeaways here. Fluid situation, vulnerable populations should prioritize, investments are critical, and political will is needed. So I am hoping that we can look at you for political will.
Well, let me say to the last point that was made by Anne, I couldn't agree more. I mean, the way you build muscle is by using muscle. And what that means in the case of healthcare systems in a multiple year pandemic is that everyday systems that can surge in a crisis are the best emergency systems. So what that means practically, Anne said, is integration of vaccination programming into routine immunization programs. It also means when we think about test and treatment strategies, that those ought to be integrated into routine clinics and part of hospital management. I mean, doing that isn't just smart pandemic strategy to fight this pandemic. It's actually smart strategy to fight the future epidemics, not only of infectious diseases, but the epidemic of premature death that we see around the world from many causes. So I think that we've got to, as we say in the United States, chew gum and walk at the same time. It's not pandemic versus geopolitical crisis. The pandemic is a geopolitical crisis. And it is possible if we use the kind of strategies of using the muscle we have and building it as we fight this pandemic to build everyday systems. It's actually possible to both respond to the horrific suffering we see in Eastern Europe and also to fight this pandemic.
Thank you so much, Raj. And we have run out of time. We've gone a little bit over time. I thank all of the panelists for their thoughtful contributions. And Gary, I will hand this over back to you. Thank you so much.
Thank you, Desta, and thank you to all the panelists. A fantastic discussion highlighting a number of key issues, all of which now beg the question of what needs to change. And that takes us to our second session, shifts needed in the global COVID-19 response. And I'm going to turn it over to our moderator for that session, Gail Smith, CEO of the One Campaign. Gail, I leave it to you to take it forward and introduce your panelists. Looking forward to a robust discussion. Thanks so much.
Thank you for that, Gary. And thanks to everybody on that last panel. I think it teed us up really, really well. I'm delighted to got a great panel. And let me briefly just share with you who we've got with us this morning, afternoon, or evening, depending on where you are. We've got Isaac Aguel, esteemed professor and former Minister of Health from Nigeria. Alejandro Cravioto, the chair of the WHO's Strategic Advisory Group of Experts on Immunization, wisely called SAGE. Taxina Haidar, honorary medical officer, at the Shahid Zaharati Medical College and Hospital in Bangladesh. Nath Reddy, the president of Public Health Foundation in India, and Julie Gerberding, the CEO for the Foundation for the National Institutes of Health. Now, what we'd like to do here, if I could say to my fellow panelists, is move quick and tight, building on the last discussion, so we can make sure we've got some time at the end for questions. People really want to take advantage of the fact that you are here with us. So let me start, if I may, with Srinath. In the discussion that we just came out of, there was a lot of mention of how do we change course? And if you think about the moment we're in, we know three things. We know, number one, that countries that have achieved high vaccination rates are now deciding that they can live with the virus, while countries that are under-vaccinated and under-supported are concluding that they may have to live with the virus. Number two, we know that this pandemic has exposed structural systemic inequities across the world that we're still up against. But number three, we know that despite what Raj said about pandemic is over syndrome, this pandemic isn't over. So Srinath, let me start with you. What do we really need to think about when we think about what needs to change as we enter year 3 of this pandemic? Over to you.
Firstly, I think we need to very clearly recognize the lessons from the pandemic so far. First is we cannot eradicate this respiratory virus. We have to reduce its potential for harm. We have not yet reached the stage of endemicity. The virus is still mutating and changing form. It is circling the airport of endemicity, but it has not yet landed on the runway. So we still need our seatbelt. Now, second is vaccines that we have now do not curtail person-to-person transmission and prevent infections, because firstly, they do not provide sterilizing immunity and prevent entry of the virus into the respiratory tract. Also, the virus is mutating frequently to produce a series of variants with higher infectivity and greater capacity for immune evasion. Third, vaccines do provide, however, good protection against severe illness to persons who are fully immunized, and they protect against serious illness, hospitalization, and death, and we should take full advantage of that by protecting the most vulnerable sections of the global population, and while we try and cover everybody with the vaccination. Then, if the virus stays long enough in the bodies of persons who are immunity compromised or debilitated, then there's a greater scope for more mutations and new variants. And therefore, the strategy has to be ensured that the vulnerable sections of the population all over the world are adequately immunized as fast as possible. And therefore, vaccine equity is essential to protect people from severe disease and prevent the emergence of dangerous new variants. And we also very clearly recognize that efficient, equitable, and empathetic health systems are required in the steady state if they are to mount a swift, strong, and sustained surge response when challenged with a public health emergency. And therefore, we need health systems all over the world which have to move from a crisis response to a sustained capacity building, particularly with a very strong primary healthcare focus for dealing with any public health emergency at the very inception and then continue to long-term care. And we also need, because vaccine equity is absolutely pivotal, we need greater investment in vaccine development, production, and distribution, particularly distributed all over the world, not concentrated in a few areas. And we need to look at pricing and patent issues so that vaccine equity is not undermined. And we need health system capacity to deliver vaccines in quick time to all the people who need it, whether it is the primary vaccination or the boosters.
Thank you. Thank you for that. And I want to thank you for your analogy about the plane not quite landing at the airport yet, because we're hearing a lot that, oh, it's endemic now, as though that somehow means we can just relax. And I think you've made a very strong point that we can't do that. We've got to focus on vulnerable populations, and we've got to think about sustainability. That's where this integration comes in. Dr. Haidar, if I can turn to you, you know a lot about what this means for health workforces around the world. And I think that's one area where, frankly, the world has underinvested, and that's the same group of people we rely on for public health across the board. What would you say needs to change in terms of how we support that very vulnerable, but also critically essential group? What needs to change to make that more sustainable?
Thank you, Gary. I hope you can hear me.
Yes, we can.
Okay. To manage the ongoing COVID-19 response and create something more sustainable for the future, the world needs a stronger health system. And the health system depends on technology and medical countermeasures, of course, like vaccines, But according to me, most importantly, they depend on the healthcare workforce, and most of them which are women. And during the current COVID-19 crisis, 90% of patients facing roles of mainly nurses were held by women. Yet only 25% of senior leaders in global health are women. This creates an unsustainable system in which those who know their communities and populations best are not at the decision-making table. Women health and care workers have been subjected to violence, harassment, and grossly under or unpaid, with an estimated $1.5 trillion. And for these reasons, women health and care workers are leaving their professions, with some estimates showing up to 1 in 3 planning to leave. Before COVID-19, the world was 80 million health workers short of reaching universal health coverage by 2030. The COVID-19 pandemic has seen more than 180,000 health workers die and has exacerbated the shortage. To create a sustainable health system for the future, health and care workers, of whom 70% are women, it needs safe and decent working conditions, and they need access to safer and adequately fitting personal protective equipment, and a safer workplace free from violence. And they need equal pay, and because investing in the health workforce will build stronger and most robust health system ready for the next pandemic. And I think ending the current pandemic means equitable access to medical countermeasures, such as between the countries and also within the countries. And future pandemic prevention and response must include women at the decision-making table. And women health and care workers know that the community is best, and are thus they can do best in decision-making. Actually, I'm focusing on women health because I have seen and I have faced difficulties during working in a developing country like Bangladesh. So that's why I'm focusing on this point for sustainability of the health systems for the future. So the key messages I want to give is for a sustainable health system, we must follow coordination and planning and implement some strategies to support the healthcare workforce, engage and mobilize the communities to limit the exposure, and find, test, isolate, and care for the cases and quarantine contacts for control transmission, and provide the proper clinical care and maintain essential health services to reduce the mortality.
For that, go ahead.
That's all I want to say. Thanks.
Thank you for making a really, really important point. I think we know that at a quantitative level, right, we need to provide more support to frontline healthcare workers, whether it's ensuring that they're vaccinated, but also ensuring that they have the PPE and the safe working environments that you described. But you've also touched on something really important that comes out in the inequities, which is there's a qualitative piece about who is at the table, and the importance of women not just comprising the majority of the workforce, but being at the table for reasons of obviously equity, but also outreach and expansion into the community. So this is just a really, really important point I want to thank you for raising it, but let's make sure we hold on to that because it's absolutely key. Let me turn to Alejandro, if I may. Vaccine strategy. We've heard a lot about focusing on the most vulnerable, on the elderly, on healthcare workers. There's a lot of debate out there now about, well, 70%, maybe we should abandon that target. I'm going to put my bias on the table. I think 70% is a good target. It always was a good target. It's the target that we have strived for in the United States. I think the debate is a bit of an expression of failure because we haven't met it everywhere. Given where we are now, how do we need to think about the vaccine strategy going forward? Over to you.
Thank you very much for inviting me. And I like to state that the opinions I'm going to give are mine alone and do not express necessarily those of the World Health Organization. And Lindstrom can do that. I cannot as an external person. I would say that the success of the vaccination has shown that we can put in practice something that was almost non-existent in most countries. Programs to vaccinate adults, especially older adults, are part of the high-income countries' health systems, but not the low and middle-income countries. Except for vaccinating against influenza in some of our countries, it was really a challenge now to have access to this elderly population that we needed to prioritize because they were the ones who were dying more at the beginning of the pandemic. And the success with which we have done that is, of course, dependent on the quality of the system that we have, but also on the community engagement that we have, which is something that we cannot forget. If we don't convince the people to get vaccinated, then you don't have a success. I think even in high-income countries where the vaccination rates have not gone beyond 60%, I think it shows clearly that we have a difficulty of communicating why people need to be immunized to be protected. On the other hand, we do have now something that we need to really look into, which is this hybrid immunity, especially after the Omicron surge. We have a huge amount of people that have been infected naturally by the virus in this way that seems to be less severe, but also that produces an immunity that can help us prevent further infections. So we have to balance now the two things. There's a paper 2 days ago in the Journal of the American Medical Association about the rate of infection in rural and urban communities in Mali. And it is amazing that over 50% of the people in the urban areas and 30% in the rural areas have been exposed to the virus with very little mortality, which is something that shows that each country has a specific epidemiologic situation, and the vaccines for these groups and the people to be vaccinated have to be seen in that environment. So I am glad that COVAX now is looking at a very different way of sending vaccines to countries. One, asking the countries what they need and not just sending whatever vaccines are available. And although the world is thankful for the rich countries to send the excess vaccines to the poorer ones, that is not a solution in any way to the problem in the long run. So in that sense, I think the countries need to make an assessment of what are the type of vaccines they need, what is the population that needs to be vaccinated as a priority, and for that, SAGE has made this roadmap that seems to have worked because it's also based on ethical values that have been the purpose from the beginning of our exercise. And the last thing I would say is that it is then for the country to define how many vaccines they need and how are they going to pay for them. So in a sense, I think we're coming into a new strategy in which we have to be more conscious of the needs of each one of the countries and then make accessible to them through the systems that we have in place, how the vaccines can come in a time and in a manner that is good for the country to be able to use them. We're sending vaccines with very, very short time span, and we have heard that already. But we're also sending vaccines that are very difficult to handle in many ways in a fast way. So that is where we need to have a balance in that. And finally, not all vaccines are the same. And I think we now need to make an assessment how we can use them in a more efficient way. How should the vaccination process be done between the different platforms that we have used, and which is the best way to use this vaccine sequentially? And I don't think that for priming or for boosting, we need the same type of schemes. And that is something that we really need to work on because, of course, the vaccines are produced by different companies and they're not packaged together in the sense of have this one for the priming and this one for the boosting. So we need to come to an agreement of what is the best strategy we have. And that means an assessment of the science that has been gathering very quickly over the past 2 years on how we do this. I agree with Srina that the plane has not landed yet, but we do have a huge amount of information that we didn't have before, on which we can base much better decisions that we have made so far. I would leave it there. Thank you very much.
No, that's great. And I just want to pull a couple threads from what you've said. I think that first one on how we communicate about this so that we get the coverage we need has been a theme throughout the pandemic. And clearly we all need to do better on that. But I think your other point, you're basically talking about rationalizing the system. So it starts with the countries rather than starting with the supply.
Yes.
And that's a really big shift. It's a really important shift. I think we all know that from a public health perspective, that's the smart way to do it in any case. But we've got two opportunities if we do it that way. We can match the supply of vaccines to where the demand is and build up from there, number one. But as you rightly point out, we can start to finesse the allocation of vaccines according to what type works where. The one point I would add to that one of the things that needs to change, many of us have called for this, is we also need greater transparency in terms of the production availability of vaccines, where they can go, because it's been very hard to get to that level of specificity because we're working in the dark. So we should all keep on that. But that's really, really helpful. I've been informed, unfortunately, that Julie was not able to join us. So Professor Isaac, I'm going to turn to you. We've heard a lot, and I think it's absolutely valid, about the role of communities in this and the importance of having ownership and direction there. We also know that leadership and political will, while they're not things we can quantify like money, may be ultimately as important as money. So speaking from where you sit, how do we need to think about that differently going forward? What needs to change in terms of leadership and political will?
Thank you so much, Gail. Leadership is key in several undertakings, and the COVID-19 pandemic brought out the best in us at different levels. And what is also important is for me to highlight some of the key actions that were taken, both globally, continentally, and at a national level, in order to mount an efficient response against COVID-19. I think one of the things that also interested me a lot was the fact that many countries conducted joint testing and evaluation even before COVID came. So there is need for preparedness ahead of COVID, and in fact, we should start preparing even for the next pandemic. The other thing is the sense of urgency that happened, and the coalition between the political leadership, as represented by the UN, the WHO, the African Union, and the African Center for Disease Control, and the technical leadership, the WHO and the African Center for Disease Control. We also had effective plans and coordination, which to me helped us in a lot. We were also able to mobilize resources at global level and at continental level. For example, in Nigeria, there was a unique partnership with the private sector, and about 50% of the funds that were used came from the private sector. The private sector has a lot of resources. There is a lot of discipline, efficiency, and accountability in the private sector. So there is need to work with the private sector. In addition to that, we also executed that plan with precision. We deployed public health approaches. We enforced it. For the first time, people were asked to wear masks, even though we had some difficulties, because our culture is actually not compatible with wearing masks. In many of the African societies, we cannot socially distance in a place where a family of 6 stays in a room. So how do you social distance in that situation? But we were still able to maintain some of these actions. We invested in training. We invested in laboratory upgrade. In many of the countries, labs sprung up within a short time, and we built oxygen plant and delivery system. We killed ICUs. We mobilized the workforce and also engaged the community. And I think for the first time, we had proper referral system being put in place where cases are brought from home, from small villages down to centers where they're needed. And we also use data. In addition to that, communication was key. But then I don't think we're out of the wood yet. And as one of the panelists said, the plane is here to land. I want to disclose that we need more than political will. Political will alone will take us nowhere. We need political action. We also need political commitment. We need funds on the table. In addition to that, we need to stop knee-jerk approaches. One of the reasons why we failed in the developing countries was that we imported policies and approaches in the developed countries. Many of the developed countries, there was lockdown. That was fine. How do you lock us down in Africa, where in fact people live daily? We do not even store food. We do not have power. So how do we store the food? So there was even riots because people were not too happy because we were adopting strategies that were not indigenous to our culture. So we need homegrown approaches. We need to produce our own vaccine. It is not that Africans don't like vaccines, but we do not trust these vaccines that are made from outside. The anti-vaccine brought out a lot of insinuations that we were not able to surmount. Let's produce a vaccine in Africa. And I'm happy that at least 5 of the countries, WHO is helping us to ensure that we develop capability to produce vaccines in Africa. We need to produce the PPEs locally. When the world shut down, there were no PPEs. There was shortages of gloves and face masks. These has to be produced locally. Pharmaceuticals has to be produced locally. And we need to build trust. A key issue is that there was lack of trust. The modeling that were used did not help us. And I think that is a major issue. The projections were that the corpses would line our streets, but people did not die. They were sick, there were antibodies. In my town, 50% of people tested, health workers, had antibodies, showing that they've been exposed, but they had no symptoms. So we need to recognize that the fact that one is infected does not mean that person will die. We also need to strengthen primary care centers. Much more importantly, very key, and build surveillance systems and promote disclosure. The issue of grabbing people and say, oh, you are COVID positive, we are going to lock you up in an isolation center should stop. That creates stigma and people run away. Even when they have signs and symptoms suggestive of COVID, they hide. So we need openness, we need destigmatization. And I think we also need to invest more in education. Again, let me round up by saying it is not over. We need to let people know that it's not over, but we need to continue to invest. We need to share experiences. We need to network and ensure that whatever affects us affects other people. The world is a village, and therefore we need to support Africa to rev up vaccination. And there's a difference between vaccines and vaccination. What we want is vaccination, not vaccines. Thank you.
Yeah. No, thank you, Professor, for that. And I think yours is an important distinction, that political will is one thing, political commitment is something different because it translates into real action. And I think there are a couple of points that came across here that we really need to underscore. You are reinforcing a comment that was just made when you talk about increasing production, geographical diversification of production. It absolutely has to happen. We know that one of the constraints we've faced is it's too concentrated. But also your point about local strategies is how do we learn for the next pandemic, and even as we proceed in this one, draw more from what we know in countries about our own experiences, using, as you rightly say, the data and the evaluation we have. But I also want to underscore something you said at the top, which you described some of the things that have happened in Africa with the Africa CDC, with the AU, with the purchase of vaccines. And to me, that's always been an example of using political will to coordinate across an entire continent to bring as much to bear as possible. And I think that's an important takeaway. I think it's served the continent very well, as has your point, importantly, of the role of the private sector. We think about leadership and political will on this and where the resources are coming from. Governments have a big role to play there, but I think we also need to pull this thread in terms of what the professor just said about the private sector stepping up and providing capital and expertise in these instances. Let me, I think maybe our hosts will be happy because we're near to on time. What I want to do is make sure we've got time for some questions that have come up in the chat. And a couple of them have to do with the narrative. Change the narrative to spur more action. How do we overcome the notion that for a lot of the world, there is the presumption that somehow this pandemic is over? So let me ask it this way, and I'll go really quickly across the whole group. If there was one thing we need to do to change the narrative going forward, to compel action, let me start with you, Srinath. What would your one thing be in changing the narrative of this pandemic?
Well, I think it's fairly easy to show the figures that are emerging from Hong Kong and even from South Korea, which so far has been a success story in containing the pandemic. Not only have the caseloads gone up, but the deaths have gone up. It's not just the number of infections that we are really concerned about, the number of hospitalizations and deaths. And if you are actually seeing overcrowded hospitals and queuing outside crematoria, then that actually is a very powerful message to tell the world that the pandemic is not over. And actually, the variants could circle back either in the current form or in a new form and sneak through the barriers to infect countries which think that now they have it under control. And travel bans don't work. That's something that we have very clearly recognized. So I think we ought to really provide that kind of imagery and keep constantly reminding people that the danger is not past.
I think you're 100% right. It's still an emergency, and we've got the data and the evidence to show that. So we've got to drive that home. Thank you for that. Dr. Hadar, may I turn to you? I would say we need to get out there to change the narrative so the world doesn't decide it's all over and we can rest. Doctor, I think you may be on mute.
Yes, I have.
Yeah, go ahead.
I couldn't hear anyone.
One of the questions we got in the chat. Can you hear me now?
Yes. Yes,
okay,
I can hear you.
One of the questions we got in the change the narrative in order to compel action. And Srinath just said we need to underscore that it's still an emergency. There are still people dying. We're still at risk of variants. So the question to you is, what's the one thing you would say we need to do to change the narrative so that we can press the world to compel more action?
Actually, the demands on the health workforce have been enormous and unending throughout this pandemic, COVID-19. So I think if one thing I want to say to my fellow COVID-19 workers, health workers, is to take care of themselves first so that they can serve better. Like if we take care of ourselves, we will be able to serve more efficiently to the people around us. So
I think that's right. And I like the fact that you've got two audiences. It's saying to healthcare, the workforce, that if we can protect ourselves, we can serve better. I think the message in terms of the broader narrative is that our global health workforce is at risk. And I think that's one of the messages we need to convey. I think that's totally attended to. Alejandro, what's the one thing you would throw into the mix to change the narrative?
I think that we need to move from being restricted and use fear into something that is more positive. I don't think that we have really engaged with people who know how to communicate these things at another level. The pandemic has shown us that there are certain things we can do safely and certain things that we cannot do that. But for example, restricting education for children by closing schools is a no-go. We need to open our schools and we need to do that safely. Now for that, we need to vaccinate the teachers, we need to vaccinate the children if we have vaccines available for them. We have to convince the parents that we need to vaccinate their children, etc. But so far, what we have used is this type of restrictions, these lockdowns, and then this creating fear in the community that if they don't do something that we think is what they should be doing, they're going to be at risk, instead of convincing them of what is the need really to change the way you behave, the way you interact with other people to do it. I don't think that there has been really a good way of creating confidence in people to be able to make them do what they need to do to stay safe. So if you restrict that, and if you, especially with the elderly, you isolate them from their families, their grandchildren, it comes a moment when nobody wants to do that anymore. If you force people to wear a mask instead of convincing them why they should do it, then people get fed up with these things. Yeah. And that's human nature. And that's not the COVID. It's any type of restricted situation that we have to live into in that sense. Now, if you look at the way other things have been put in place, like wearing seatbelts, we convinced people that that was the only way not to have an accident by showing them what it was. And I think we need to move into something that is more understandable and more clear. And also that even with the infection and the variants and with the vaccines we have, with the treatments we have available, there is a possibility to go back to a kind of normal life, which is what everybody's aiming for. If we continue just with the restrictions, we're not going to get the response that we want. And all these wonderful developments, the vaccines and the drugs, are going to be not enough to be able to really move the people into a way that they can have a normal life, a safe life, even with the circulation of the virus. I think that we have to understand that this is a situation that is not going to be in the short run. We won't be able to solve it in the short run. So therefore, we need to, as we do with other viruses, learn to how to live with them. In that sense, the idea then of how and if we're going to use these vaccines in a different way has to be something that we really need to start putting on the table as a way of discussing and telling people what to do. But I am someone, even as Dr. Hayder was saying with the health force, we haven't convinced all the nurses and all the people who work in hospitals to get immunized because we haven't made them feel the need and the security they have for these products in that sense. So from a high standard of us scientists thinking that we know best what people need, it's easier then to make a number of rules and a number of decisions. But the way that we communicate them with the rest of the people is something that we have been dreadful about. And I think that needs to be changed if we want to be successful in the next weeks or in the next months to be able to curb this.
Look, I think you're absolutely right. And I think you've locked onto something really important, which is if we are at a stage where, whether by choice or by circumstance, we are all going to have to live with this virus. How do you live with the virus? And turning this notion of restrictions on its head, and instead of saying kids should be kept home from school, saying we need to make sure teachers are vaccinated. Way of making the argument. I think it's a subtle shift, but I think a very, very important shift, because then it's not about restrictions, it's about enabling normal life. And maybe one of the things we need to think about with the messaging you talk about, where it's not wear a mask because I told you so and I know more than you about viruses and therefore you just got to trust me, to you don't want to get the virus, I don't want to get the virus, but I want you to have a normal life, be able to do what you do, go to the shop, go to the store, meet your relatives. If you wear a mask, you're going to reduce the risk and you'll protect them. So it's more of a, again, enabling some semblance of normalcy rather than imposing what has been. And look, I think these were the right things to do in the initial phases when we didn't have vaccines and so on, but still it's instead of imposing a restriction. And it's a really, really key point, because I think we know in every country all over the world, and we've had questions about it in the chat, whether it's vaccine hesitancy, whether it's outright resistance, whether it's just opposition to somebody telling you what to do, we've hit a ceiling in some places. Yeah. And I think your point gives us some good food for thought about how we break through that. Professor Isaac, if I can come back to you, if we're going to change the narrative and reframe this pandemic going forward so that we can compel more action, what would the one thing you would say is the most important?
I think the most important thing for me is to build trust. It's very critical. Trust will turn vaccines to vaccination. Trust will enable us to adopt non-pharmaceutical approaches, and trust is all we need to even patronize the health system. So to me, trust is so key in this business.
You're 1,000% right. And I think that feeds on the point that was just made. I think one of the ways that we can build more trust is that in your own interventions and on the last panel, there was some discussion of the need for responses to come at least equally, if not more so, from countries themselves, rather than from a kind of global edict or even well-intentioned external advice. And that may be one way to build more trust, is to make sure that the response to this.
I think the last speaker mentions even the reluctance of healthcare workers. This we found that many health workers refuse to take the vaccine, and that created doubts. And when we try to find out from people, who do you trust? They mentioned family members, including leaders in the family. They mentioned physicians, healthcare workers, and they mentioned community leaders. People did not trust politicians. They would not even want to move near them. So I think healthcare workers are very key. We need to really work within ourselves, and so that in a way that if we take the vaccine, others will take it. But when we refuse to take vaccines, then what we're telling others is you better not take it.
Yeah. No, I think you're 1,000% right. And yours is a good point. I think we're living in a time where there's less and less confidence in government and politicians than there's ever been. So those trusted interlocutors are absolutely key. I want to ask another question that's come up in the chat, and it's a practical question, but it's one that's got some politics to it, which is, all of you have referenced evaluation data, what we know now that we didn't know 2 years ago, what we've been able to learn. And it's been one of the, I think, really reassuring outcomes of the first 2 years of this pandemic, is how we can build a knowledge base and act on that. But we've got an obstacle, which is there is neither the kind of coordination or transparency around data that we need, so it is widely beneficial. Let me ask, has that been your experience? And what do you think, again, if we are saying to the world, and the next panel is going to focus a bit on what we as a community need to be saying to the world, how do we need to think about that? How do we foster a climate? What do we need to do so that this data, this knowledge is seen as a global currency, right? That everybody should have access to, so that we can have the greatest advantage. I'm going to go in the same order, Srinath, and let me go to you. What do we need to do on the transparency front?
Well, firstly, I think we need to ensure that data are gathered, analyzed, and applied at different levels.
Yeah.
We do need a data-driven, decentralized decision-making at community level, in municipalities, in villages, and I mean, essentially at the district level or even the sub-district level. Then, of course, there will be data with higher degree of entries and complexity, which goes up to the state or provincial level, at the national level, and then at the global level. When you find that the data are being applied very fast, then there will be demand even from the community for accurate and timely data. Otherwise, it appears to be something that is being gathered by somebody at the national level, compiling some statistics, and not really always accurate or timely. So I think the importance of data will come from trusting people to respond to the data and make decisions as close to the ground level as possible, then build up the complexity upwards for supportive supervision, resource allocation, and strategy modification. But you cannot treat data as an abstract entity only for policymakers sitting in rarefied rooms in national capitals or in global organizations.
No, thank you for saying that, because I think, again, this is another instance where, again, what we're hearing is people have got to have trust in the data and know where it comes from, and know that it starts from the communities and builds up from there. Alejandro, transparency data, how do we think about these things going forward?
I just would like to say that I think we should all be very thankful that most of the big producers of scientific information have been generous enough to open up free of charge all the data coming out of this COVID pandemic for everybody to read. New England, Lancet, JAMA, all the big journals have given a free access to every single thing coming out of the COVID pandemic. And that is something that I don't think we acknowledge enough, because that's a cost and that has other implications, but it clearly shows that we can come together in that sense of sharing. On the other hand, I do feel, and I think the World Health Organization has tried to do it, is to tell countries what is the data that is needed, both for their own purposes, but also to join forces with others. For example, surveillance of adverse effects. We now have a group in the Pan American region organized by PAHO to be able to look at adverse effects in a more systematic way, so that we're all looking at the same vaccines and in the same way, so that we can see, by joining forces and using the vaccine in more and more people, what are the things that we need to be aware of in the case of the use of these products in the long run. So I think that on one side, I agree with Trina that we need to make people aware of what the data is useful for them. But on the other hand, we also need to have a more systematic approach at gathering information that can be then joined together to be able to have a better understanding of what is happening around the world. And this idea that everybody has a methodology and everybody uses a different test to do their things is something that has created confusion in that sense. These fast tests that we have all over the world that we need to get on a plane have such a variety of quality, and that we cannot really make an assessment of this information. So in that sense, I think that especially for the follow-up and to make people secure that the vaccines that we're using are safe, we do need to have a much better system of the data gathering, in the sense of what is the things that we need to make sure that everybody can contribute. And in that sense, given the opportunity of using the same product in a huge amount of people throughout the world with very different genetic backgrounds and everything else, if we gather the information in a more systematic way, I think that that would give us a much better understanding of where the problems might be in the future. On the other hand, I do feel that gathering information without telling people what is the use for them is something that has been a constant problem, and those are the forms that everybody has to fill in to send to WHO every year or to UNICEF, that the people do because they need to, but not because they understand why, of what is the benefit for them to be able to gather in that information. And that happens a lot with governments. The central government, the Ministry of Health, wants information about a number of things, and people are made to fill in forms and send them on without any feedback to them of what that information meant to what they're doing in the field, of what is the benefit for them to have gathered that information for their own practice or their own way of dealing with the problems at a local level. I think that that is something that perhaps now, because of the amount of information coming out of this pandemic, in that sense, we can have a more a judicious way of looking at this gathering of information, but also, as Srina was saying, to make people aware of what is the benefit for them to have gathered it and use it for their own purposes.
I think that's really important. And I hear you talking about the need for more coordination, but also getting back to this trust issue. And ironically, transparency in data. What do you want this data for? How does it affect my life? I think the more we can make that available, not only can we tailor responses, as you said in your first intervention early on in this session, but I think we can also start to build that trust, because it turns out that when people have facts in their hands and know why people are asking questions, their trust increases. Dr. Hadar, you shared some really important data in your first intervention about the workforce and women. When we think about data and transparency and making sure this information is widely available, what do you think needs to change as we move forward? Are you on my screen there? I see you. Taskina? You're on mute and I don't see your camera. Okay, maybe we'll hold for a second and come back. Professor, can I come back to you, sir?
Thank you, Ma.
You're welcome, sir. Go ahead.
Yeah, what's my question?
Your question is on data and transparency. One of the questions in the
Yes,
chat was about. Go ahead.
I quite support some of the submissions of Alexandra, but I think we need to go beyond number of cases and number of deaths. We also need to look at absenteeism. How has it affected our socioeconomic life? How has it affected society's families? Because for us in Africa, people are getting infected, but not many are dying as we anticipated. So we need to look at other indicators. And then we should move away from scaremongering and then do more testing. Because what we've also not done in Africa is more testing. We need to do more testing because if we don't do more testing, we'll also not be able to contribute to global data. So I think we need to invest in data and we need to allow openness and transparency. This is important. And also let people know what we are using the data for. Because sometimes people are so protective of data that they don't even want to release it. And also, we should not tie funding to data. Quite often, we tie funding to data, and so people falsify data in order to get more resources. So they link data from funding so that people can be more open and more transparent. Thank you.
And we've come to time. I want to thank everyone on the panel and all those participating and for the questions in the chat. Just say a couple of things in summary that I really hear as key and consistent takeaways. The first is on trust and how critical that is, but I think we've had some good insights on how you build that. Telling people why you are asking them questions, making sure that the data and the information comes from and goes to communities. I think switching from compelling and requiring restrictions to enabling people to live their lives. That's a subtle but important shift. I think, Professor, the point you just made about tracking indications, not just of incidence and death rates, but other indicators. That gets back to what we were discussing before about how do we change the narrative. This pandemic is not simply a health crisis. It's an economic crisis. It's a social crisis. It's a security crisis. How do we collect data there and make that more relevant? Finally, I think a key point, and I heard a bit about this in the last panel, so I just want to underscore it. We've learned an enormous amount. And I think one of the things we've learned and one of the things that has to change is, not surprisingly, putting more power, authority, and design in the hands of communities and countries. We know a lot more than we did 2 years ago, when we were all kind of going with general guidance that was one size fits all. We've got the advantage, the opportunity, and I think the obligation now to take what we've learned, recalibrate, and again, put more of that power and design into the hands of the communities and countries that we need to get to as quickly as possible. Finally, I will leave us with a point from our first panelist, which is that we've got to show that this is possible. We've got to make clear to the world that an emergency is still underway and we can't let up now. With that, let me thank all the panelists, all the participants, our hosts, and we're going to close and go to the next panel. Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you, Gail.
Sure.
It was a remarkably robust discussion, and I want to thank all the panelists. And a fabulous summary you just made. In addition, they talked about the shift from emergency response to sustainable pandemic control and what that means about living with COVID going forward. The shift to prioritizing vaccinating at-risk populations and health workers especially, and to ensuring a more sustainable workforce and health systems. And as you noted, the shift to supporting country-driven plans and local production of vaccines and PPE and other COVID tools. Now the question becomes, how do we muster the political will, the resources, and the accountability for action to make those things happen? That's the topic of our third session, how to change it, the actions needed to accelerate the global response and pandemic preparedness. And for that, I want to turn it over to our moderator, Amanda Glassman, Executive Vice President and Senior Fellow at the Center for Global Development. Amanda, I leave it to you to introduce the panelists. Thanks so much.
Many thanks, Gary, and thanks also to the previous panelists. We have the charge to discuss how to change. We've discussed what needs to change and now how we should change it, or to land the plane, as one of the panelists from the previous session was discussing. Maybe we could get rid of the slides so that people can see all the panelists for this session. I think we've been asked to help set direction and prioritize actions that governments and multilateral institutions, communities, and the private sector should take now to respond to the evolving needs around COVID-19 and to lay the foundation for greater preparedness and more resilient health systems in the future. I'm joined by Priya Basu, who's the head of the COVID-19 Task Force Secretariat at the World Bank Group. We have Benjamin Coughlin, who's a senior health specialist at the Asian Development Bank. Benjamin, if you're there, could you turn on your video? We have Patricia Garcia, who's a professor, former Minister of Health from Peru at the Cayetano Heredia University. And we may or may not be joined by Mosoka Papafala, who's from the Saving Lives and Livelihood Partnership between MasterCard Foundation and the Africa CDC. I understand that he's having some difficulty connecting. So let's get started. We've heard a long list of actions that are needed. We've heard that this is still really a global emergency. On the other hand, when you look at that global COVID-19 access tracker, there are a couple of points that stand out to me, and I want to go back to you and ask, how do we strengthen accountability given this evolving circumstance? So first, when you look at sort of deaths in the last 7 days, it looks like from that global map that's on the global C19 access tracker, low-income countries, generally speaking, are in the green. They're in a good place, but there's data problems that we know about. Even in South America, we see Chile red with high levels of deaths in the past 7 days being reported, probably because they're reporting excess deaths. And we see Bolivia right next door, green. What does that mean? What's going on? Is that we still don't have a handle on the data? Is that a priority going forward? Second, the issue around middle incomes and absorption capacity. Of course, there's been a lot of attention to the fact that low-income countries have had a slow start because of the supply constraints. But on the other hand, we now see we see countries vaccinating fairly rapidly, using most of supply with some exceptions. And we see a lot of middle-income countries in that slow pace of vaccination category. What does that mean? Is it a financing issue? Is it something else? And what could be done about that? And I think a third issue, especially because we have two people from multilateral development banks on this panel, is around country demand. So what are the priorities from that you're hearing from your member countries, from your borrowing member countries? How much are they accessing the financing that had been made available? What do you see as the issues around that? And then finally, I guess, it's sort of like, what do we do about all this? I think we've heard so many important messages from the previous panel around this orientation to country demand and adjusting targets, around the need to prepare for the next COVID-19 variant and pandemic risk, around the need to push for transparency in all kinds of data and to improve our data, to improve our game on science guidance, communication, and trust. So we have a big agenda. How does that translate to reality? What are the issues that you see? So let's start with you, Priya. You've helped bring us the COVID-19 globaltracker.org. I'm going to drop it into the chat. for people to take a look at if you haven't seen it already. Can you reflect a little bit on these issues?
Thank you, Amanda, and hi everyone, and it's a pleasure to join you all today. So yes, I mean, you know, I think one of the good things, I mean, every crisis, to use a cliche, is an opportunity, and I think one of the good things that we've seen over the past couple of years is that there has been a big focus on data. And lot of efforts to try to collect and share and disseminate that data. And as part of that effort, one of the big things that we've been working on at the World Bank, along with the WHO and other partners, including the IMF, the WTO, and so on, has been this global COVID-19 access tracker, which really tracks progress to global goals. But behind this tracker is a lot of data that we've calculated, that we've compiled through the Multilateral Leaders Task Force. We have a dashboard that pulls together data on vaccines, but also on therapeutics and diagnostics, drawing on many different sources. And there's been good data from our multilateral task force partners, including the IMF, the WHO, the WTO, and so on. So definitely there's been progress in data collection, but of course more needs to be done. But we're off to a good start. So I mean, data is a priority, and it will be important to sustain all these efforts and strengthen this data during interpandemic years, because one of the issues across various dimensions is that pandemics spur action, but then that action doesn't necessarily sustain itself once we're on the other side of the pandemic, which of course we're not yet. You asked a number of questions. I think one big question that I would like to focus on is that what do we do about all this? How do we prepare for the future? We are certainly not on the other side of this pandemic yet, but now is kind of the window of opportunity. I feel that the impetus for action will fade once we're on the other side of the pandemic in richer countries. So how can we seize this moment to really make some bold changes? And one of the bold changes that we've been working on at the bank with our partners is really to close the large funding gaps that you, Amanda, in your report, the G20 High-Level Independent Panel report, highlighted. We've also, done some further analysis. The World Bank and the WHO has done some further analysis for the G20 to calculate what these financing gaps are. Certainly domestic financing will need to play a big role, but for low-income countries and lower middle-income countries, domestic financing needs to be complemented by external financing, by international financing, to the tune of anything between $10.5 to $15 billion per year over the next few years that needs to be then sustained. So this financing gap is substantial, and what can we do now to help fill that gap? That's kind of a big piece of what we've been working on at the bank, and we're in the process as I speak in putting together, moving quite quickly to put together a new fund that will help fill these gaps. And the important things, how can such a new fund help? A lot of questions have been asked in external fora. It'll help focus high-level attention on pandemic preparedness, signal its importance. This is a kind of it's not, the importance of that shouldn't be understated, just sort of signaling that this is an important agenda that requires single-minded efforts. Of course, it'll provide additional financing that'll be dedicated to pandemic preparedness and response with measurable results. We wanted to incentivize domestic investments, so whatever funding it provides, it'll it'll motivate developing countries to put in more money. We wanted to help coordinate among key stakeholders. For example, it can provide funding in a way that's contingent on, PPR action plans at the country level that are coordinated across partners. And we also think, very importantly, it will serve as a platform for discussion and advocacy on PPR issues. So, those are the kind of key benefits that we see of a new fund that we're working on. And, we are designing it in a way that will bring additional resources, long-term sustainable resources that will have the flexibility to operate through existing institutions, drawing on their strengths and comparative advantages, so that we're not creating a new institution. We're not creating something that's going to further fragment the global health financing architecture, but rather, a financial intermediary fund that will work through all the existing key institutions that are engaged in global health. It will complement what they do. It will coordinate across stakeholders. So once again, I really think that this is a window of opportunity, which we may lose quickly. We really need to act on it and work fast. And of course, there are needs at all levels. There are needs, this kind of a funding mechanism, it can help across dimensions at the country level. There are huge needs to strengthen PPR capacity across all domains of international health regulations, disease surveillance, lab systems, emergency communications and management, community engagement. All of these key capacities need to be strengthened at the country level in low-income and lower-middle-income countries. And beyond that, at the regional and global level, we see there are huge opportunities to do more to network up that surveillance, strengthen reporting and information sharing, regional labs, regulatory harmonization, capacity, building capacity for coordinated development, manufacturing, procurement of medical countermeasures, strengthening regional institutions like Africa CDC, building dedicated PPR entities. This pandemic has shown that regional entities have played a huge role. So what can we do to support that? So those are the kinds of things that we think, there's an urgent need to start helping. Let's not wait more. Let's really not get into that cycle of panic and neglect and, forget about all these investments and wait until, the next pandemic hits us. I mean, that would really be, economically and morally indefensible. So we really need to start acting now and acting fast across all of these domains. And at the World Bank, we're really committed to doing that. We're working really hard with our partners to get this done, as quickly as possible. So happy to answer any more questions, but really wanted to put that out. Thanks.
Great, thank you. So it's a really interesting time to see that a new financing mechanism for global health security and pandemic preparedness is starting to take off. And I think we were all excited to see President Biden's budget request for 2023 with a very substantial amount tagged for that use while still sustaining contributions to the rest of the COVID-19 response and to existing global health partners. So that looks to be good news, and we'll definitely be following all of that carefully. I do want to come back to you, Priya, about the sort of in follow on to the previous panel, sort of what to do about the inequities that are sort of persisting in the existing COVID-19 response. And if you can reflect a little bit on sort of what an MDB, that's a multilateral development bank, can and can't do, because it really is a country demand-based model. And sort of how that's all working out. Maybe I'll go to our colleague at the Asian Development Bank that really had been also thinking about this from very early in the COVID-19 pandemic. You had the great vaccine financing that was really set up so early and is a great model. But even though that was in place, it was difficult actually to get the money going and to land some of that vaccine procurement and delivery. So maybe I'll ask you to sort of reflect on the role of a regional development bank within the context of regional institutions, what you would see as key to landing the plane in the rest of COVID-19, and then we can also turn to preparedness in a moment. Go ahead.
Sure, thanks, Amanda. Yeah, I think you're right. The ADB's focus throughout this has really been on vaccines, right? So establishing a $9 billion facility to procure vaccines and deliver those. Now, only about 51% of that has been spent to date across 17 developing member countries out of the 49 that we're responsible for. And the interesting thing there is that this facility was designed to have a rapid response component, so grabbing the vaccines and the logistics to support that, but also came with an optional project investment component, which was a highly flexible mechanism for countries really to choose how they would like to simultaneously strengthen their health systems to deliver those vaccines. Interestingly, when we look back at the 4.63 billion that we've approved, only about 4% of funds were used for the project investment component. And I think that was the demand. The demand really was, there was a supply constraint, no one could get vaccines, any vaccine was needed, and countries didn't have the luxury of thinking about how can we leverage this investment for longer term disease control benefits, pandemic preparedness. I think that's shifted now, and we are in a kind of the eye of the storm, if you like, where countries are kind of saying, look, our vaccine coverages are going up, and Asia's a lot better than Africa, apart from a few exceptions. We're getting Omicron, but it's not typically overwhelming most of our states, member countries. And so countries are now beginning to say, well, we need to do something else now. And the demand that we're hearing really is around vaccine manufacturing. And this is, I guess, where we're seeing a convergence of ADB's move to remove some of the bottlenecks around accessing vaccines. So that includes working heavily on regulatory environment by forming a regional vaccine advisory group of 12 national regulatory authorities to really guide us, but also to facilitate that interagency collaboration so that they can all lift each other up and share information. So that's been a really good fit for us. But also we're seeing, two of the world's leading manufacturers, two of the top three, India and China, who produced together almost 2/3 of every dose delivered on the planet. So we can learn, we're seeking to learn from their experience in building up such a huge manufacturing capability. And also now the Republic of Korea, stamping its flag last August with their president saying they want to be a new player in vaccine manufacturing, and they want to help their countries, neighboring countries in Asia Pacific. So all of that is really aligning where countries are now coming to us and saying, look, can we have money to build vaccine manufacturing facilities? And we're saying, well, this also needs to come with the entire ecosystem. You can't just have the facility. You need a strong regulator, particularly if you wanted to export vaccines. You need a good idea about the market dynamics so that you can sustain these facilities in the longer term and therefore contribute to regional good around this vaccine security. And also we're beginning now to think about some of those clinical trial needs and the R&D needs so that these countries themselves can run everything from start to finish and not be reliant from companies outside the region which are looking at this through an entirely different lens. So that's really where the demand is coming. And I think we're also now seeing at the regional level, with ASEAN in particular, who look, a natural political collective, much like the African Union, beefing up its own regional credentials in terms of playing effectively a regional centres for disease control, with a new facility called the ASEAN Centre for Public Health Emergencies and Emerging Diseases. Now, I think that is driving some of the countries in our region to say, well, look, we need our own CDCs as well. We've looked at Korea that did very well and had a sort of fully fledged CDC. We've looked at some of the other countries that had well-coordinated public health responses, having learned from two previous coronaviruses, SARS and MERS. And now we want to drive that. And as I guess ADB is a kind of a pan-regional, pan-Asian organization, we are interested in looking at, the parallels between the Central Asian Regional Cooperation Association and the South Asian Association for Regional Cooperation. So again, putting these existing regional bodies and tacking on because there's demand, the countries now want to collaborate in ways in which they've struggled to do beforehand. So I think it's true that sort of one demand has led into another. There hasn't been a grand strategy. Countries, have looked at their IHR plans, their JEE reporting, and they've either made progress or not, but the degree of progress hasn't dictated the quality of the response really in any fashion. So I think that's where we're at now. So vaccine manufacturing is the key priority, moving on to more resilient systems through coordinated national public health institutes.
That's really exciting developments to see really the growth of public health institutions around the world in response to this pandemic, and then to have some financing available to be able to invest in those entities going forward. Let's now turn to Bobby. Welcome. So, I think we gave you the very easy topic of accountability. So we're talking about landing the plane, and that accountability, operates at many levels, at the community level, the local level, national level, regional level, we've just been talking about, and of course, at the global level. In your view, how can we do better as a global health community, sitting at our various levels and acting on different levels, to hold greater accountability for the existing response? Because I think it's we can see that the attention is already going to the next thing, and what is it that governments need in terms of the attention from civil society and universities and experts to keep their focus on the mission?
Thank you so much. Yeah, and you're giving me the 1 million, no, maybe the 1 billion or $1 trillion question. I mean, if I wish I could have the answer, right? The reality is that accountability is something that we need at all levels, as you said, okay, but it's kind of complicated. In order to be accountable, you need, or there is a need of knowing what is going on there and to follow, okay? So what we are talking about is having information systems, good data, being able to share, and on the other side, whoever sees the data being able to understand what that means. And I'm talking about everybody, okay? So one of the issues that we have with data, definitely, is that there is a need of improving data and the architecture of data and how do we use data to be able to hold anybody accountable or to see what is going on in the countries, okay? But the use of data should not become also harmful for countries. I mean, and the best example, the worst example maybe, is what happened with South Africa. Peru, for example, okay, we have been probably, and this is something that is not very much discussed, but I want to bring this to this discussion. In 2017, we started in Peru a system, an electronic system to notify, to register death certificates, okay, in the country. And we evolved trying to get better data. And when the pandemic started, as a country, we decided to use that data. Not only that, there was also an incentive, okay, for people and physicians to report. So if people were reporting somebody who had died and had COVID, the government will help them for all the funeral, etc. So I guess probably we had the best system notifying deaths, and that result in that at the end we became the champions of the deaths around the world, maybe because we were more honest. But there was no response, no global response to help, okay? We were not the ones to receive some help with vaccines. It was very difficult, although we had the money, it was very difficult to negotiate. So I'm just giving you that example because I think data is very important to be held accountable. But at the global level, we need to see ways in which, instead of having perverse incentives, we could have incentives for countries to really share data. So I was talking about accountability and traceability, because those two things can be given by technology, okay? And that could be really, really helpful. So how can we hold our governments accountable, okay? I think there are different levels. I think we need to work, and maybe, as Priya said, and I love what she said, seize the moment to make bold changes. We need more community involvement and engagement. But for that, I think there is a need of working on health literacy and better information, because people may not understand what is there, and people have the right to fight for what they need. We need stronger, better, more resilient, and more accountable health systems. And for that, probably technology can help. Electronic medical records that work well, more transparent systems, etc. I think civil society has an important role, but okay, I think even civil society needs to know what works and what doesn't. And I think during this pandemic, we have been discussing, and we have been really struggling to see what could be the best actions in order to control or prepare for the pandemic. So I think we need to organize all that data and try to make it public. This should be a public good, so people will know what to ask for. And from the point of view of the governments and maybe cooperation agencies, it's not only the matter of financing. Financing is quite important, but we need to be sure that we have quality in the expenditures, okay? Which means, to be clear, that we have to avoid corruption on one side, but also there is a need of technical support. So accountability is critical. Maybe information systems can help. We need all the levels of the society when we talk within the countries, and at the global level, I think we have learned that solidarity is a word that doesn't exist, and we need to have some other types of mechanisms that will, I don't like to use this word, but I'm going to use it, okay, force countries, okay, to have the right response, okay, and maybe we can learn from what is already there. I mean, these treaties that had to do with trading, I mean, some type of treaty globally that can hold accountable the high-income countries or the countries that have the resources or the capabilities on how to behave in these emergency situations. And I think I definitely think that things like this discussion, okay, and several discussions that I'm listening are making me feel that maybe we are moving into those bold changes, okay, but still, I fear that we need to do a little bit more to be also prepared. So it's not only a matter of thinking what is happening with COVID from now on, but what are the kind of things that we need to prepare for the next pandemics? And I stop there.
Absolutely. I think those are really great points. And especially, you know, I think the story of Peru, you're right, is so much less told than what happened in South Africa with the reporting of the Omicron variant. And that, you know, differing in a way, the whole global health enterprise, which is set up, you know, low-income countries, middle-income countries, high-income countries, had trouble responding to need as expressed through, worse situations in certain countries. Although, you know, anyhow, there's lots of discussions about that that would need to be held. And I think, you know, the other point that you're making about the pandemic treaty, I think is really important. And I had heard that the G20 is also meeting on trying to standardize travel requirements between countries, for example. So something as simple as what's the protocol for testing and the documentation that's required, we still haven't figured out between the different countries, and it creates an enormous amount of inefficiency. Okay, so let me go back. Let's talk a little bit about I'll come back to you, Priya, on the sort of getting the job done with COVID. Of course, you know, what if there is a more virulent variant that requires new vaccine? what would we do then? What would you imagine the bank's role would be in responding to something like that? And then, of course, thinking about the next panel, Grace, you sort of laid out what the financing response could look like in that case. But this is obviously you're not speaking for the institution, but what would you imagine that we would do differently if there were a more virulent variant and we needed a new class of vaccines, and then we needed to ramp up again all the other pieces of the COVID-19 response? How would you see things being different from our initial response to COVID?
So thanks for that. And as you said, Amanda, at the start, this pandemic has amplified inequities at all levels, and the data is showing. It speaks for itself that the inequities between the world's poorest countries and the richest countries are kind of really have been sharp throughout on every dimension. So initially, just maybe to step back a bit, what do we do initially with the when the pandemic broke? The first response was really just to kind of to focus on saving lives, right? So and providing cash support and just helping families weather the impacts of the pandemic. And then as soon as vaccines began to be available, the bank put out a large vaccine support program to help countries procure vaccines and also to deploy them. And as of now, we now have vaccine operations in 70 countries, and we have $7.6 billion committed for those vaccine operations. Obviously, for most of last year, the challenge was a supply challenge. There were huge constraints in getting vaccine supplies to developing countries. I think there are a lot of lessons from that because developing countries and the poorest countries found themselves really at the back of the vaccine delivery queue. With the constraints on vaccine supply now having eased, our focus has pivoted strongly to helping countries deploy those vaccines, because it's one thing for vaccines to get to ports and airports, but the challenges of actually getting vaccines from ports and airports into people's arms can't be underestimated. And those challenges range across many dimensions: logistics, cold chain capacity, trained vaccinators, in some countries vaccine hesitancy, so how to kind of engage communities and how to help countries with the basic infrastructure to get these vaccines from ports and airports into people's arms has been the big focus. And as I mentioned, we have these operations in 70 countries, 70, where the financing from the bank, the $7.6 billion committed, can be used. A lot of it has been used for procurement, but there's a lot available for deployment on the ground. And we're working with partners like the COVID-19 Vaccine Delivery Initiative. I think Ted Chaiban was going to join you, but he wasn't able to. But we're coordinating very closely with him, UNICEF, Gavi, WHO, others, to really get these shots in arms. Okay, so that's kind of, and then on top of that, therapeutics and diagnostics and other critical countermeasures. In the first phase of our response to the pandemic, most of what we financed under the health our health program was things like PPE and oxygen and ventilators, whatever's needed, then now vaccines. So now, what has this pandemic taught us? What will we do differently? I think everybody has learned a lot from this pandemic, and I think lessons. You should devote another seminar to that. But just very briefly, I think one thing is, how can we now prepare the world? And I think you asked this question, so that the next time round, if there is a pandemic, we don't face a similar situation where the poorest countries find themselves at the back of the delivery queue for all essential medical countermeasures. I think that's kind of one big lesson: how to ensure that that there's enough being produced, but that also countries that need it the most, and countries have guaranteed a secured place in the queue so that they can use their financing to sort of get these medical countermeasures quickly. And that comes to then, the preparedness agenda that we're working on. One dimension of this is to build that capacity at the regional level, to finance that capacity at the regional level, not just to ensure that there's enough being produced, but that also, there are procurement mechanisms that are in place that can then quickly procure on day zero, the goods that are needed for the countries that need them. So kind of linking the building of manufacturing capacity to sort of assured procurement. And I think we have lessons from COVAX, we have lessons from AVAT that we can apply going forward. So that's kind of one big piece. I think Benjamin mentioned the investments that the ADB is focusing on in vaccine manufacturing. The private sector arm of the World Bank, which is the IFC, is also focusing heavily on this as a 4 billion global health platform that includes investments in vaccines, but also other medical countermeasures to help not just with this pandemic, but also the next one. I think one thing we need to be careful about is that one needs to be sort of strategic in terms of where these investments are made. Of course, there's there may be interest amongst many countries to produce to have their own capacity. But I think there's there are benefits of doing this more regionally, more strategically, making these investments in a way that they can be sustained. So we have a strategy. I know we're coordinating closely with the ADB on that, but I think the big point is, yes, the world needs that capacity, and the world needs mechanisms at day zero of the next pandemic to be able to procure these and ensure that they get delivered on time, and that we're not in a situation where some countries have 8, 9, 10 times as many vaccines as they need, while others, are waiting to get them. And then just finally, as this pandemic evolves, I think, for our client countries, they're seeing more and more, they're looking at it as this becoming kind of an endemic sort of COVID-19 becoming endemic. So we're thinking and we're working with countries on ways to do things like weave in COVID-19 vaccinations into routine vaccination, into routine immunization programs, and sort of think about how this can become part of the global the country health priorities. Lastly, you asked about this country demand model. So, I'm firmly of the view that all of these investments need to start at the country level. Some of them need to be aggregated up to the regional and global level. But by definition, any investment in pandemic preparedness and response is a global public good, but those investments have to be made at all levels. So, it's a global public good requiring investments at the country level, requiring some investments at the regional level, and requiring some investments at the global level. So when it comes to the country and regional level, the World Bank's core funding instruments, which are the IBRD and IDA, are very well suited to helping with the country level investments. And indeed, that's what we've done. $157 billion has been our unprecedented COVID-19 response. With country and regional level investments, we have ways to invest in regional pandemic preparedness. We've supported the Africa CDC. We've got a big regional disease surveillance program in Africa, which actually was put in place post Ebola, and it's reaped good results. We're working on how to replicate it, build on it, strengthen it. So, and then at the global level, we have a range of trust funds and other kinds of partnership programs that enable us to engage at the global level with global institutions. So, and that's kind of one piece that that we're building on more in the context of this this fund that I spoke about, which will help us, invest at all 3 levels. So just to say, I think it's important to oftentimes people talk about a global public good, and then they say, well, MDBs, focus on country level, but investments in global public goods have to be made, at country level, at regional level, and at global levels. I just want to leave you with that. And I think lots of lessons, we're kind of working on, acting on those before we forget. Thanks.
Excellent. Thank you, Priya. So we have a couple of minutes left. I'm going to ask Benjamin and Patricia to reflect on their series of summits coming up, G20, G7, maybe a Biden summit on COVID-19 response. Can you tell us sort of what are your top two asks? And then Benjamin, if I could come back to you, you talked a little bit about that market ecosystem around domestic manufacturing. And Priya's also mentioned that every country now wants to manufacture their own vaccines. What gives? What are the issues that we have to think about in that? And what role do the regional MDBs play in that discussion?
Sure, thanks. Yeah, look, I think that's hard. We've had lots of donor countries come to us and say, this is a bad idea. We don't want countries doing this. It needs to be thought through. It needs to be strategic. But that's very hard when a country says, look, we missed out for a year for vaccines. ADB, we cannot lend money at risk to purchase vaccines which don't meet our criteria. And those criteria require the vaccine to be finished, to be vetted in terms of its safety, its quality and effectiveness. So because we can't lend money to purchase substandard products, right, or unsafe products. So it's realistic for countries, especially countries with big populations, to say we need some degree of vaccine security here going forward. So I guess our approach to that is really on an on-demand basis, to look at the countries that are doing this, to bring them into regional discussions about this and to apply the best knowledge solutions for them that we can. So that means bringing in the best people to look at the market viability of any products that the country has, and we're developing training courses in partnership with the Republic of Korea for basically to educate countries on what will it take to become a vaccine manufacturer. So is this wise for us to invest? Is it a good public sector investment? Should we support our private sector to do this, or should it be a blend? And we think most countries are approaching this in a reflexive way, which is completely understandable, but we want them to do it in a considered fashion. We don't want, there was a bit of promotion after H1N1 for new vaccine facilities, which are now redundant. So we want countries to clearly think through the different vaccine platforms, what's suitable for them, what's affordable, and how do they do that in a carefully phased manner, not just rushing through a tech transfer agreement and ending up with products that they cannot use domestically or even export. So that's, I think we're trying to tick all the boxes there in terms of moving towards a strategic approach. We are hopeful that some of these emerging regional entities will drive through those agreements between countries so that we can land in a space for vaccines as a regional public good in the event of pandemics. And the same for pharmaceuticals or diagnostics, really. We need to have all tools available to all countries as soon as they're developed. So the top asks, I think, look, it's been a theme, I think, throughout the previous sessions is, we have also internally and externally be saying we should not take our foot off the pedal, okay? If we look in the last month, the top 10 most rapid increases in infections, they're all in Asia Pacific. The top 6 countries that are classified as oxygen at risk countries, they're all in Asia Pacific. And some of those are very small Pacific states, albeit small populations, but they have very, very weak health systems. And so we cannot afford to let our guard down on this. We do not know if the next variant that throws up is going to be worse or better, or will it peter out, which I don't think anyone believes. So I think our message is also these longer system investments, they're not guaranteed. Countries have been burnt by the pandemic, and while they've invested in health now, we are not sure that there is going to be demand for that. ADB is signalling that we will come to the party there. So we're increasing our share of health from something like 1 to 2% in the last sort of 5 years, up to 6 to 10%. So we're encouraging countries to invest in health because we see this as a health and an economic and a social imperative. So I think that's the main thing. And then to couple that with much better conversations between health and finance, so that finance can see the value of investments and health can make those arguments convincingly. So while we may say the pandemic's made a pretty good argument there, you know, as you said, Amanda, at the outset, you know, attention does wane, people get tired, other priorities come into the mix. But this is one we cannot afford to let go. And I think this is for all health aims here, you know, universal health coverage, driving down other endemic communicable diseases, addressing some of the challenges in our region like aging, and, you know, this increasing digital divide. So that was sort of the one message, but really a few flavors to it. Thanks.
Excellent. Well, thank you. Those are great ideas for the upcoming summits. Okay, Patricia, to take us home, what would you ask for? The economics of these investments make sense. Someone in the chat, Robert Entine, notes the huge return on investment for this. But how to keep governments accountable in this effort?
Well, first of all, I would like to start by addressing the fact that the pandemic is not over, okay? And that there will be more pandemics to come, and we need to be prepared and be able to respond, okay? So that's my first premise. And the second thing is that I think one of the top priorities now that we need to discuss, because we know that there is not such a thing like solidarity, okay, is again, and I'm going to go again with this idea of, I hope that in the summits that are coming, one thing that is going to be discussed is this issue about the treaty. And this treaty that should include issues like how to avoid perverse incentives for early reporting, or we can make it positive, right? How can we incentivize early reporting of possible viruses with potential pandemic that could become potential pandemic threats, and that probably that positive incentive could be some type of insurance or something that should be and technical support that should be given by the globe, by the whole globe, because at the end we all live in this world, okay? But that treaty should also include issues like funding and tech support for those countries that honestly in their health security index are failing, okay? Because for years, what we have been doing is measuring how bad countries are doing with this index, but nobody has cared, okay? Countries were reporting it, but they didn't have the resources or the capacity or the interest. So how can we have not only the index, but how can we support to pass the test, okay? Because that it will be good for everybody. Then the third thing is in this treaty also, how can we create this regional technological autonomy? I'm not talking about countries only, and I love what Benjamin was saying. I mean, I know that regional development banks are starting to promote countries or regions to understand what that means. But we have to remember that in the 70s, for example, for Latin America, Latin America was evolving in technologies, etc. But at some point, the discussion of the experts was, it's not going to be effective because you have like small markets, etc. It's better if you give the prime materials and others prepare the things, but it doesn't work. I mean, even with funds, we were not able to find medications, PPEs, or vaccines. So I think there has to be some type of technological autonomy for public health okay, goods and vaccines specifically. And in Latin America, we were discussing about maybe sharing different components between the countries. I mean, this is not going to be to gain resources, it's going to assure health. And finally, my fourth point in that treaty is how can we together strengthen health systems? Okay, I don't think any country in the world has been able to prove that they have a good health system. Something is failing, so we need to discuss that.
Okay, well, thanks to all of you for a great conversation. I think the asks to the global community are clear, starting with a vigorous continued response to the existing pandemic using all the tools that are available, making some of these long-term investments in domestic manufacturing, not just of vaccines, but pharmaceuticals, tests, things like that, developing, learning the lessons from the previous experience to new preparedness financing to address both the next variant and the next pandemic risk. And of course, continuing the focus on incentives and accountability. I think that's a really important point that you made. It's, some of the new funding can be used to create those incentives for better on-time reporting of deaths and disease, making it more accurate and more complete, decreasing the disincentives to share that information with the rest of the world. So our work is cut out for us. We shall watch this space, and I think I'm to turn it over back to Gary. But thank you so much to all the panelists for a great discussion.
Thank you, Amanda, and thank you to the panelists. As Priya said, we need to seize the moment to make bold changes. To talk about how we seize that moment and to close this mini summit, I want to turn it over to Carolyn Reynolds, the co-founder of the Pandemic Action Network, and Krishna Udayakumar, Director of the Duke Global Health Innovation Center and Director of COVID Gap. Carolyn?
Thanks, Gary, and thanks to all of our panelists today. And what a rich discussion. Thanks to all of you for joining. What's very clear is that we need to act. We need to take action to control this pandemic, to prepare for what's going to come next, to end it for everyone, and to prevent the next one. With summits, with global summits, we ask our leaders to make commitments. So what I'd like to ask all of you today is to join in the chat and say, what is that action that you're going to take coming out of today's conversation to advocate and to accelerate action, to press for the kinds of changes we've discussed today. And so I encourage you to join in that chat. What we talked about, we started this conversation by talking about the fact that this is there's a lot of competing challenges in the world. People are tired of this pandemic. There is fatigue. There's a climate crisis. There's a war. Yes, all of those are challenges that we need to face, and many, many more. But I think, as Raj Punjabi said earlier on, this pandemic is also a geopolitical crisis, and we need to treat it as such. From the very beginning, the world has never actually, in a way, come together as a global community to do what is needed. And here we are, more than 2 years into our third year into this pandemic, because of the failure of leadership in many cases. So we hope that this summit is a chance to shift this dynamic at this particular port. And actually, I would argue that we need that war footing. We need to have that war mentality when we think about fighting this pandemic and preventing the next one. We have a lot of assets, as we've talked about today, at our disposal. We have knowledge. We have tools, weapons, if you will, from vaccines and tests and treatments that we didn't have just a year ago. We have lived experience of almost every person on this earth with this pandemic. And so those are all tools in our arsenal. But there are things we need to do. We need, like any good battlefield commander, we need better data. We need to continue to not only deploy the tools we have, but develop that next generation of tools or weapons to prepare for what comes next. We need to have better communications. We need to have better transparency, as was talked about, better agility to prepare for the unknown. And I would argue we also need greater ambition. We need to be investing now, not just in fighting the war in front of us, but in preparing for the next one. And that means putting in, as we fight this war, those capabilities, those systems, those sustainable resources in place to make sure we are prepared for these threats that we know are not only before us now, but are coming fast and furious because of the world. That is the world we live in, and the data is very clear. There will be another pandemic, and it might even come as this one is still unfolding. So we need to treat this very differently. We need that whole of society, whole of government approach. And we have not yet cracked that nut. So we need everyone here to be part of that solution. I see coming in the chat, vaccine equity, communications. We know what there are many things we need to do, and I hope others will continue to add into that. But the message I want to leave you with is that all of us need to be part of that solution, and all of us need to be advocates. We have our areas of expertise, our spheres of influence. We need to apply do what we do best, but we also need to become advocates in our communities, in our countries, and in the world. And we need to, as we talked about, enable locally driven strategies, but again, as part of, any good commander will tell you, as part of a coordinated battle plan that reaches up from local to national to global to regional to global. So that is our charge coming out of today's session. I think as Dr. Ahmed said early at the beginning, and I want to come back to that, our charge is to make sure that we really do break down this us versus them, and that we make this our collective challenge, and that we bring others beyond those of us who may work in global health or in related sectors, that this really is seen as a challenge for the world and for all of us, and to get our political leaders to act. There are summits coming up we're going to be watching, but most importantly, pressing them to act. And so with that, thank you for your engagement and community engagement, the right to all of the things that are in the chat, the right to health. We need to press for all of that. And I think, as Patty also said, we need to press for better rules of the road. So we have a lot to do. So we're only just getting started. And that's why we created the Pandemic Action Network. And that's why we are pleased that, to host conversations like this that we hope will compel the kind of action that's needed. Let me turn it over to our partner and to close it out, Krishna from Duke University. Over to you, Krishna.
Thank you, Carolyn. What a fantastic call to action and way to end today. Thank you all. I won't try to summarize a fantastic conversation, but some takeaways to end with is really a lot of what we talked about is how do we seize this moment of what seems to be transition and turn it into a real moment of opportunity? And to do that, how do we really think about framing our conversations as both and, as opposed to either or, and use those both ands to mobilize political will, political commitment, and resources, and also to improve accountability. So how can we both control the current crisis and strengthen preparedness and resilient health systems by developing the right capabilities and a sustainable and supported workforce? How can we both protect the most vulnerable and expand access to all tools broadly, including vaccines, but also tests, treatments, and more? How do we both empower more local, community-led and country-led efforts and apply the lessons over the last 2 years to strengthen the regional and the global response and support? I'm very grateful that you've all come together today, and also that we're ending this discussion focused on actions going forward, because that's what we need to do. I'm also hopeful that we will continue to find more opportunities for compelling and productive conversations like we've had today. With that, let me just thank a few folks. First, the moderators and the speakers for such fantastic work by making this so productive. Secondly, all of the conveners that brought this conversation together, the Africa CDC, AMREF Health Africa, the Andean Health Organization, the Center for Indonesia Strategic Development Initiatives, the College of Medicine at the University of Ibadan, the School of Public Health at Cayetano Heredia University, WAKI Health, and the Pandemic Action Network, in addition to our team at the COVID Global Accountability Platform. Many thanks to the Rockefeller Foundation and the Gates Foundation for supporting this work, and also a huge thanks to the PAN and COVID GAP teams for pulling all of this together in a very complicated journey. And last but certainly not least, I want to thank all of you for joining us today, the participants, not just for joining today, but also for everything that you're doing to end the pandemic and also prepare for the future. With that, thank you very much and have a good afternoon, morning, or evening, wherever you are in the world. Thanks.